May I have your attention, please? The 11th Republic of Korea-SAARC Partnership Seminar will begin at 14. Please take your seats and turn off or silence your cell phone during the seminar. A simultaneous interpretation is available, and take your receiver on the table. Korean is available on channel 1, and English is on channel 2. The seminar will be started soon. Please remain in your seat. Thank you. The seminar will be started soon. Please remain in your seat. Thank you. Okay, the seminar will begin. Welcome to 2020, the 11th Republic of Korean-SAARC Partnership Seminar. I'm No Ki-hyun from Asian and Pacific Regional Cooperation Division from Ministry of Foreign Affairs. Thank you for attending the seminar. Before we begin, for the prevention of COVID-19 and for our safety, please make sure to wear a mask during the seminar, except when speaking. Also, hand sanitizers are available at the registration desk, so please use them whenever you need them. The theme of this seminar is RK-SAARC cooperation on public health and poverty alleviation in the time of COVID-19. We used to invite representatives from SAARC member states, including government officials or eminent experts from academia. Unfortunately, the ongoing pandemic would not allow us to have our seminar in the usual setting. So this time, we would like to replace it with a video from the panelists of SAARC countries, and we invite representatives from the related embassies in Seoul instead, and share the received videos during the session. Participating representatives from the embassies and Korean representatives will have fruitful discussions on the direction of Korean-SAARC cooperation. The entire seminar will be recorded and live-streamed for the member states. As for today, we have an opening session and 3 other sessions with different agendas. We also have dinner from 6 to 8. To open the seminar, ladies and gentlemen, please join me in welcoming Mr. Kim Chang-hyun, the Deputy Director General of Asian and Pacific Affairs Bureau of Ministry of Foreign Affairs, Republic of Korea, to the stage for welcoming remarks. Please give a big round of applause to Mr. Kim Chang-hyun.
Thank you, Mr. No, and I'm really grateful for my great staff for preparing simultaneous interpretation today so that I can speak in Korean. 예, 안녕하십니까? 존경하는 내외 귀빈 여러분, 먼저 제11차 한-SAARC 파트너쉽 세미나를 찾아주신 여러분을 환영합니다. 근본 11차 세미나를 내실 있게 준비해 주신 한국외국어대학교 인도연구소에 대해서도 감사드립니다. 특히 오늘 세미나 참석을 위해 특별히 자리를 빛내주신 사크 회원국 인사 그리고 학계 인사 여러분 반갑습니다. 존경하는 내 귀빈 여러분, 우리는 지금 중대한 위기의 한복판에 서 있습니다. 보이지 않는 바이러스는 우리의 일상을 근본적으로 변화시키고 그 변화는 각국의 경제사회 구조뿐만 아니라 국제 질서에도 큰 영향을 미치고 있습니다. 모든 국가가 연대와 협력의 정신으로 힘을 모아 이 위기를 극복하고 나아가 이 위기를 기회로 삼아 나가야 할 것입니다. 이러한 점에서 한국과 남아시아 국가들이 한자리에 모인 이번 세미나의 개최는 아주 시적절하다고 생각합니다. 비록 코로나19 상황으로 인해서 서울로 오시지는 못하였지만 이번 세미나를 위해서 귀중한 경험과 지혜를 담은 영상을 송부해 주신 각 사크 회원국 인사들께도 다시 한번 감사의 말씀을 드립니다. 한국과 남아시아주 국가 간의 유일한 1.5 트랙 회의체인 한-SAARC 파트너쉽 세미나는 2010년부터 매년 개최되어 왔습니다. 그리고 다양한 실질 협력 분야의 논의를 위한 한국과 남아시아 국가 간의 소통과 협의의 장으로 활용되어 왔습니다. 매 세미나는 한국과 남아시아 간 협력 사업 현황을 점검하고 양 지역 간 미래 협력 방향에 대한 청사진을 설계하는 자리로 기능을 해왔습니다. 내외 귀빈 여러분, 근본 제11차 한-SAARC 세미나에서는 코로나19 시대의 보건협력과 빈곤 구제를 주제로 남아시아 국가와 한국 간의 실질 협력을 논의해 보고자 합니다. 현재 남아시아의 코로나19 상황은 여전히 심각합니다. 7월 2일 통계에 따른 것인데요. 사크 회원국의 누적 확진자 수는 102만 명을 기록하고 신규 확진자 수는 2만 8천 명 수준을 기록했습니다. 이 수치는 서부 유럽과 아시아 일부 국가에서는 점차 완만한 그 확진자 및 사망자 수치를 보이는 것과 상반된 동향이라는 점에서 우려할 만합니다. 한국 역시 마찬가지로 코로나19를 극복했다고 단언하기는 힘든 상황입니다. 그동안에 성공적으로 확진자 수를 줄이는데 성공했지만은 최근 해외 유입자를 중심으로 다시 확진자 수가 늘어서 결코 안심을 할 수가 없는 상황입니다. 코로나19는 모두가 안전하기 전까지는 아무도 안전하지 않다라는 말이 있죠. 이번 세미나는 코로나19 시대의 보건협력에 초점을 맞추어 서로 상황과 경험을 공유하며 보건협력 방안에 대한 내실 있는 논의를 통해서 코로나19 확산 차단과 종식에 기여하는 자리가 되기를 기대합니다. 내외 귀빈 여러분, 코로나19는 결코 단순한 질병이 아닙니다. WHO의 그 코로나19 특사인 데이비드 나바로는 코로나19는 가난한 이들의 질병이라고 설명했습니다. 빈곤율이 높을수록 보건의료 서비스의 접근성이 떨어지기 때문에 코로나19로 큰 피해를 받을 확률이 높은 것입니다. 아울러 사회적 거리두기 및 재택근무는 임시직, 일용직, 특수고용 노동자 등의 취약계층에게는 현실적으로 이행하기 어려울 뿐더러 고용 충격으로 다가올 가능성이 높은 것이 엄연한 현실입니다. 아울러 코로나19로 인해 부각된 비대면 경제와 비대면 기술 자동화는 취약계층의 일자리를 대체하게 되고 이로 인해 취약계층의 빈곤 문제와 사회 내 불평등의 문제가 악화될 것이라는 예측도 존재하고 있습니다. 이번 세미나는 코로나19가 야기하는 다양한 불평등성에 주목해서 빈곤구제 협력을 의제로 상정했으며 이번 세미나를 통해서 남아시아와 한국의 상생 번영 방안 및 불평등성 해소에 대한 집중적인 논의가 이루어질 것을 기대합니다. 존경하는 내외기빈 여러분, 도전이 있는 만큼 기회도 있는 법입니다. 전문가들은 지금의 코로나19 위기가 아무리 긍정적으로 봐도 짧게는 몇 개월, 길게는 몇 년간 이어질 것으로 예상을 하고 있습니다. 하지만 남아시아가 가지고 있는 성장 잠재력은 코로나19에 유무와 관계없이 이 지역이 가지고 있는 가장 큰 기회가 될 수 있을 것입니다. 남아시아 지역은 2019년 평균 약 6%의 경제 성장률을 기록하며 세계 인구의 약 24%인 17억 8천만 명의 인구는 세계 기업들이 진출을 가속화하는 잠재력으로 작용하고 있습니다. 이러한 상황 속에서 근본 세미나는 코로나19로 인해 남아시아가 처한 도전 요소를 극복하고 남아시아 지역의 잠재력을 회복시킬 수 있는 방안을 논의하는 좋은 계기가 될 것입니다. 존경하는 내외 기빈 여러분, 마지막으로 한국에서 자주 회자되는 사자성어를 소개하면서 마무리를 짓고자 합니다. 동주공제라는 말인데요. 이 말은 같은 배를 타고 함께 강을 건너듯 어려움 속에서 함께 한다는 뜻의 사자성어입니다. 우리는 코로나19로 인해서 연대와 협력의 중요성을 어느 때보다도 절실하게 느끼고 있습니다. 국제사회가 각자 도생이 아닌 상생의 길로 가야 위기를 극복할 수 있습니다. 이번 제1차 한-SAARC 파트너쉽 세미나를 통해서 한국과 남아시아 지역 국가들이 코로나19라는 그 거센 파도에 맞서 한 배를 헤쳐나가는 계기가 되기를 기원합니다. 감사합니다. Thank you.
Thank you, Mr. Kim. Now we proceed to the congratulatory video message. Please join me welcoming Mr. Esla Ruwan Wirakun, the Secretary General of South Asia Association for Regional Cooperation.
Excellencies, distinguished participants, I am pleased to address the opening session of the 11th Republic of Korea-SAARC Partnership Online Seminar. I wish to felicitate the Ministry of Foreign Affairs of the Republic of Korea and the Institute of Indian Studies of the Hankook University of Foreign Studies for organizing this seminar. This timely initiative is a singular demonstration by the Republic of Korea to further deepen collaboration with SAARC, which we highly appreciate. The themes of the seminar are very relevant to the SAARC countries in the wake of the COVID-19 pandemic. I wish to join our gracious host in welcoming the distinguished representatives from the member states of SAARC to this seminar. I also wish to take this opportunity to acknowledge the presence of distinguished representatives from the Ministry of Foreign Affairs of the Republic of Korea and the Institute of Indian Studies of the Hankook University of Foreign Studies. Excellencies, distinguished participants, the COVID-19 global pandemic, which started as a health emergency, has evolved into an economic crisis of mammoth proportions across the globe. With the slowing down of the global economy in the aftermath of the pandemic, the functioning of global supply chains has been disrupted. Going by the initial estimates of the World Bank and IMF, possible negative impacts of COVID-19 on global economic growth are actually very worrying, with far-reaching repercussions on poverty alleviation efforts. Taking cognizance of the pandemic's long-term socio-economic impact, on the initiative of the Honorable Prime Minister of India, the SAARC leaders held a video conference on 15th March 2020 to chart out a regional strategy to combat the spread of the virus as well as to mitigate its after effects. As an immediate response in addressing the adverse impacts of the pandemic, the SAARC leaders created a SAARC COVID-19 emergency fund to which all the member states have pledged their contributions. As a follow-up to the SAARC leaders' video conference, the SAARC Health Ministers' video conference was held on 23rd April 2020. Apart from these two high-level meetings, senior trade and health officials from the SAARC countries have also met virtually in March and April this year. Furthermore, the interim unit of the SAARC Disaster Management Center has set up a COVID-19 portal with daily coronavirus-related updates from the South Asian countries. Excellencies, distinguished participants, the SAARC Charter aims to promote the welfare of the peoples of South Asia and to improve their quality of life through eradication of poverty, among others. With the declaration of poverty alleviation as the overarching goal of SAARC at the 12th Summit in Islamabad in January 2004, several measures have been initiated in this direction. As a result of these initiatives, SAARC has made progress in the past several decades to substantially reduce extreme poverty. The achievements made by the South Asian countries in poverty reduction have immensely contributed to the attainment of MDGs and 2030 development goals. Excellencies, distinguished participants, the Republic of Korea has been a valued and active observer of SAARC since 2006. Cooperation between the Republic of Korea and SAARC has been gaining momentum gradually in recent years, especially on the economic and development cooperation fronts. We look forward to working closely with the Republic of Korea in productive, demand-driven, and objective project-based cooperation in priority areas such as communications, connectivity, agriculture, public health, energy, environment, and economic cooperation. In conclusion, I wish to once again thank the Ministry of Foreign Affairs of the Republic of Korea and the Institute of Indian Studies of the Hankook University of Foreign Studies for this very timely and worthy initiative. I am confident that this seminar will show the way forward for further strengthening collaboration between SAARC and the Republic of Korea, especially in the fight against the global pandemic. I wish this seminar great success. I thank you.
Thank you, Mr. Weerkun. Thank you for attending the seminar. Before we proceed to the session 1, we will have a photo session. We will take 2 group photos. In the first photo, we will wear masks together, and in the second photo, please unveil masks. So could we have all the guests come toward the front? 뒷줄에 올라가셔서 찍어도 됩니다. For the beautiful picture, you can go upstairs and take a picture instead. Thank you very much for your cooperation. Now we are going to have a 10-minute breaks, 15 minutes breaks from now on. Coffee and refreshments are ready in the back of the venue, and we will see you all at 2:40. This concludes the opening ceremony of the 2020 11th Republic of Korea-SAARC Partnership Seminar. Please come back to your seat before 2:40. Thank you.
저희 그 밑에 좀 내려와 달라고 제가 문자 남겼는데요. 그 마이크 울리는 것 때문에 네. 한 번만 방문. 네. 네.
하나 둘. 둘, 셋 테스팅. 하나 둘. 하나 둘, 하나 둘.
May I have your attention, please? Now, the session 1 of Challenges of Pandemic and Global Cooperation starts. Please take your seats and turn off or silence your mobile phone during the sessions. Thank you. Now, we proceed to the session 1, Challenges of Pandemic and Global Cooperation. We will watch the presentation videos sent by representatives from each country in turn, and take the chair and panel to the stage to conduct an open discussion. The session starts with a first presentation by Dr. Abdullah Fahim, Senior Advisor of Minister of Public Health from Afghanistan.
Excellencies, dear colleagues, Afghanistan has experienced its first COVID-19 patient among the returnees from neighboring country Iran and Western Herat province on 24th February 2020. Till 10 March, we had sporadic cases in few provinces, including Kabul, after which the number of cases start increasing. On 28 March, the government decided and announced a lockdown in capital city Kabul and major cities, which was soon extended all over the country. Hopefully, the Ministry of Public Health enjoyed the full support from the government of Afghanistan, and a strong political will was there. Government has established a high-level committee under the auspice of the Vice President of the country. In the meanwhile, we have enjoyed full support from the international community, from the governments and UN agencies. Unfortunately, at the beginning, there was very limited capacity for the diagnosis of the patients. It means at the beginning we had only one lab in the central level, which was scaled up to 11, and we are in the process to increase the number of our testing facilities. At the beginning, a mass campaign on the media and within the communities has started to increase the awareness of the people about the disease and the transmission routes of the disease, which was hopefully very effective. The Ministry of Public Health has allocated 400 specific beds to COVID-19 patients in 2 government facilities, and also 900 beds has been allocated all over the country through the support of the international community and through the non-governmental agencies who are running the health facilities. As of July 22nd, the total number of cases in the country which were confirmed by lab test is 35,727. And among them, only 10,616 are active patients, and unfortunately, we have lost 1,190 patients. Considering the 60 million plus population of the country, we are relatively in better situation. Maybe one of the reasons are the young generation of the country, and in the meanwhile, maybe there are underreported cases. To find the real picture, the government of Afghanistan has conducted a household survey. We are trying to find out what is the real burden and what are the real figures of the disease. The survey has been completed. Now we are in the process of analyzing the data, which very soon will be announced. Based on the ground realities, the strict lockdown measures has been somehow eased a month or so ago. And now, again, we are looking for the results of the household survey. And the plans are to further ease the lockdown and next 2 weeks to 1 month, because a country like Afghanistan cannot survive without the small business was running here and there, and also the closure of the educational facilities and centers is another concern. That's why we have plans to go for a phase-wise and gradual opening of all businesses and educational centers in coming 2 to 4 weeks.
وضعیت قبلا خراب بود. دوستا تبلیغ منفی کرده بودن که نرین به شفاخانه افغان ژاپن بسیار رویه بد میکنه دیگه. باز آخر تصمیم شد که میاییم و امروز که آمدیم میفهمم که چقدر برادرانه دوستانه اینا آمدن و رفتار میکنن.
الحمدلله که حالت خوبه.
بله
با کسیوا و نفای ما
همشان هیچ من فکر نمیکنم که من از خانه خود دور باشم.
دوا عزیز برکن میتن یا؟
دوا در مجموع 80% از همین جاست. بس بعضی که نباشه از بیرون میارم.
خود دیگه مرض اضافی دیگه شکر چیز نباشتی؟
نه.
دیگه از فامیل تو هم گرفته یا؟
از فامیل خانم من گرفته بود جور شد شکر. مادر من گرفته بود با هم جور شد. دیگه از خودم کمک جدی بود حالا خوب شده.
الحمدلله. چی پیشنهاد داری؟ چی؟
پیشنهاد من همین زمانی که دوستای ما مریض میشن حتما به شفاخانه سی مراجعه کنم.
این چپن سفیدایی که امروز در خط اول مبارزه علیه مرض کرونا قرار دارند یا قابل احترام و قابل ستایش هستند که خداوند اینا را تا آخرین لحظات در زمان خود نگاه کنه. من از رئیس شفاخانه به خصوص جان سپاس میکنم، عملی که با او دیدن کردم یک پیش آمد بسیار درست انسانی با یک وضعیتی که واقعا شایسته یک دکتر است با من انجام دادن.
در مدت بدین ماه مریضایی که مراجعه میکردن ابتدا مریضای بسیار وخیم بود و هر مریضی که در شفاخانه مراجعه میکنن مریضای وخیم هستند، مریضایی هستند که مشکل تنفسی پیدا کردن و به اکسیژن نیاز دارند. شفته که ما کار میکنیم در 24 ساعت 12 ساعت کار میکنیم. شفتای ما به شکل 6 ساعته تقسیم شده. 6 ساعت کار میکنیم، باز 6 ساعت آف هستیم، باز 6 ساعت دیگه کار میکنیم. در 24 ساعت یا 12 ساعت کار میکنیم. تمام قدرت و توان و انرژی که داریم صرف هموطنهای خود، صرف مریضایی که اینجا سر هستن برشان میکنیم تا هدف آخر. هر دکتر ما، هر نرس ما، هر کارگر ما متحد هستند و تعهد کردن که بر هموطنهای خود کار بکنند. هموطنهای خود را انشاءالله که خاطرشان جمع میسازیم، فرزندایشان، بچهایشان در خدمتشان هستند. هر شخصی که اینجا مریض میشه در ما حیث مادر ما هستن، حیث پدر ما هستن و برسن مثل اولاد برسن خدمت میکنن. از هموطنان خود خواهش دارم که تمام چیزهای صحی که توسط وزارت صحت آمد توسط ارگان‌های صحی برشان توصیه میشه از طریق مطبوعات اونها را مراعات بکنند، فاصله اجتماعی را در نظر بگیرند، از ماسک استفاده بکنند و در این وقت کسای کار سر خود کم بکنند و انرژی بدن خود را پورا نگاه بکنند. انشاءالله که ویروس ضعیف شده روان است، خاطر همه انشاءالله جمع باشد. امو پیکی که بلند میرد فعلا 12 مدت انشاءالله که رو به نزول است و شخصیت خود ویروس از دست دادن.
سلام، من اقبال هستم، یکی از پایوازان مریض. پدرم اینجا بستر است، 2 روز میشه اینجا برخورد دکترها بسیار خوب بود، روحیه میته مریضه و بسیار از پیش راضی هستیم. خدا کلا گیره جور کنم اینجا بیارم در افغان ژاپن بسترشان کنن، انشالله پروردگار شفا میتن، وسایل از پیششان دیگه.
نگفتن اکسیژن نیست، دوا نیست،
اکسیژن فوق‌العاده است. من همیشه برای مراجعه کردم، گفتم اگر اکسیژن کم بود باشه که ما از خود شخصی بالون بیارم، گفت نمیاد، اکسیژن تو فول داریم که دیگه استاکای ما پر است.
دوا خدمات
دوا کلش نه، دوا 1 روپیه هم نگرفتن. یگان ذره کمبوتی دوا هست، کمبوتی دوا است که اینجا با سهولت هم نیست که بیرون بری دستی باشه، نه با دور بری، یعنی سهولت یک مشکل دوا هست. دیگه هیچ مشکل نداریم ما، نیکت دکتر، نیکت نرس، نیکت خدمات کلش بسیار خود نیک داره، بسیار مهربان. که مریض به این رقم رفتار کردن که مریض روحیه دادن که دیگه حال بیخی نمیخوره، اکسیژن شما را 30 آوردیم، حال 80 است.
هستم رئیس شفاخانه افغان ژاپن. شفاخانه افغان ژاپن اولین شفاخانه 100 بستر برای کووید 19 در شهر کابل می باشد که برای مریضان کووید 19 خدمات ارائه می کند. این شفاخانه دارای 100 بستر می باشد و همچنان دارای 14 بستر آی سی می باشد. خوشبختانه از آغاز خدمات شفاخانه افغان ژاپن تا به حال به صدها و هزارها مریض در اوپیدی دیده شده و فعلا ما در شفاخانه اضافه تر از 100 مریض بستر داریم و همچنان 14 مریض در آی سی یو بستر داریم. خدماتی که فعلا در شفاخانه افغان ژاپن صورت میگیرم خدمات لابراتواری و با تست های پی سی آر برای مریضان کووید 19 و همچنان خدمات توزیع ادویه برای مریضان داخل بستر. در پهلوی از ما خدمات عاجل و خدمات اوپیدی نیز داریم.
Thank you, Dr. Abdullah Fahim, for showing us current COVID-19 situation in Afghanistan. Next presentation will be presented by Dr. Palitha Karunapima, Director of Health Promotion Bureau of Ministry of Health and Indigenous Medical Services from Sri Lanka.
Sri Lanka, an inspiring COVID-19 success story. This is the story of an island nation that is well known for its golden beaches, world-renowned Ceylon tea, mesmerizing waterfalls, and home to the first female Prime Minister of the world. What defines its people is their amazing resilience to endure great calamities and defy all odds to rise again to glory. A country that was once battered by a 30-year-old civil war and devastated by a tsunami could not hold down its potential to become the best tourist destination for 2020 when the deadly coronavirus unleashed havoc at the prime of its potential. Now that we have heard all the things that Sri Lanka is famous for, it's time to understand the secret recipe behind the COVID success story of this island nation. Sri Lanka has had only 91 cases per 1 million population, 11 COVID-19 deaths, and absolutely no cases in the community for over 2 months, since 30th April 2020. It went from this to this, and came back to this. All of this took place while maintaining one of the most impressive disease mitigation records globally. This is the story of how we did it, with a GDP for health of only 3.81% and a population of 21 million. So, how was Sri Lanka so successful in its containment of the pandemic? Let's look at the contributing players and factors in this remarkable story. The first report of what we now know as COVID-19 came to the world's attention on December 31st, 2019. Sri Lanka was very quick to act on this information and subsequent circulating rumors. The Ministry of Health, with relevant stakeholders, immediately identified the need for risk communication, rumor monitoring and mitigation, and readiness for the imminent epidemic. The Influenza Steering Committee, where global health issues are discussed, organized by the Epidemiology Unit of the Health Ministry, along with the Health Promotion Bureau, discussed the ongoing epidemic and preparedness plan on the 9th of January 2020. A presidential task force was speedily appointed during the last week of January 2020, with multi-sectorial involvement and stakeholders identified at all levels. A national COVID center was established and streamlined activities to 10 committees. The Director General of WHO declared the outbreak of COVID-19 a public health emergency and subsequently a pandemic in early March. By then, Sri Lanka was on full alert with counteractive measures already in place. By the time the first local patient was found positive on 9th March 2020, regular press releases from the Ministry of Health and identified key spokespersons began very early. This built trust of the general public on the government information sources and communicated the real situation. Early emergency preparedness with strong political commitment and support by health, Triforces and the media went a long way in Sri Lanka's favor in winning the battle against COVID-19. Mechanism to safeguard all ports of entry against the import of COVID-19 were in place. The quarantine unit of the Ministry of Health had a vital role in this. The information was disseminated in all 3 local languages and in Chinese. As the epicenter of the disease was China, with many Chinese arriving in Sri Lanka for tourism and employment. A surveillance system and contact tracing mechanism was established, linking ports of entries, the epidemiology unit of the Ministry of Health, and provincial health authorities. grassroots level public health staff worked around the clock with quarantine and contact tracing. Health services were easily accessible and just a phone call away from medical officers of health teams who delivered very efficient, personalized service. Quarantine and contact tracing was so successful that there were ultimately only 6 main clusters in Sri Lanka. The Disaster Management Center also had a vital role in COVID-19 management. A very strong quarantine and contact tracing mechanism was a prime factor in our success story. Travelers arriving from high-risk countries were quarantined on arrival in special centers for 2 weeks, while home quarantine was allowed for other arrivals. But as the epidemic reached pandemic heights, with borders closing globally, all arrivals were immediately taken to special quarantine centers. Services were provided completely free of charge to those in quarantine centers, with gratifying hospitality and humanity shown. The numbers of quarantine centers and persons quarantined increased, with momentum being kept up by health staff and Triforces. The infectious disease hospital was identified from the onset as a key site for COVID-19 management, with a staff very competent in case management and infection testing. Hospital staff also communicated over media the necessity of the general public staying at home. 16 other hospitals were also initially identified for COVID management and strengthened rapidly with speedy expansion of the hospital network. Hospitals from each district were in early readiness to prevent overwhelming of the health system, even before the first local COVID case was reported in Sri Lanka. Triage for fever patients was done at hospitals in all districts. Sri Lanka was one of the first few countries in the Asian region to detect COVID infection through PCR testing. The capacity was established within the country at the Medical Research Institution and greatly scaled up to provincial level subsequently. Free ambulance services were available throughout the country for anyone reporting COVID-19 related symptoms. Massive media support was vital to information flow, destigmatization and myth-busting, with time worth millions of rupees for advertisements to control and prevent COVID-19 donated generously. Even songs were written, which were very popular and effective. COVID-19 prevention behaviors became widespread, with workplaces and the general public being immensely supportive. Positive health behaviors were greatly advocated through mass media, with tremendous impact. Physical distancing became the norm, with even major celebrations being confined to households. Further aided adoption of good practices with an evidence base. Support and aid were obtained from the World Health Organization, UNICEF, the Government of Australia, the United States Department of Defense, the Embassy of the Republic of Korea in Sri Lanka, etc. The Ministry of Foreign Relations got on board with the other sectors at the initial stage in self-facing this multifaceted challenge. The Foreign Ministry took the direct responsibility to look after the welfare of the overseas Sri Lankans and establish links with the relevant foreign embassies. The ministry has been looking into the needs of the diplomatic an expatriate community residing in and visiting Sri Lanka. Schools island-wide were closed within a day of the first local COVID-19 patient being identified. This greatly reduced the risk of community transmission and possibly prevented the transmission to the elderly, as many Sri Lankan families have grandparents living together with parents and children in the same household. Work from home was encouraged across all sectors, with flexible working hours, rosters, and minimum staff. The government rapidly mandated work from home. Mobile door-to-door delivery of essential services such as food, medicine, and even banking commenced. Postal services were utilized for door-to-door delivery of prescription medicine from government hospitals and online orders from pharmacies. Prescriptions and clinic books were used as curfew passes for access to essential health services and medicines. Pensions were delivered to the elderly, or they were permitted to visit banks on designated days to obtain pensions. Supermarket and grocery chains immediately came on board with online and door-to-door services. Agricultural work was allowed during lockdown, and rice mill owners' work declared an essential service. Home gardening and cultivation projects were encouraged by the government to help alleviate future possible food shortages and insecurities. Daily wage earners and other vulnerable households were provided with social welfare payments to tide over the crisis. Many organizations and volunteers got together to give food relief and essential item packages to vulnerable families. Support of divisional secretaries was immensely valuable in the process. Education got on board very quickly, with online lessons being conducted by universities and a majority of schools. Provision of PPE and other protective measures which were dire needs was supported innovatively by the general public. The most powerful force of all the people of Sri Lanka was the biggest asset that changed the tide on this pandemic. There are vulnerable people with limited reserves for survival, but they never fought over the supply of essential commodities. There is no better testimony of the hospitality of the islanders than the thank you notes and videos of the tourists who were stranded in Sri Lanka due to the rapid closure of borders in their home countries. They showed the world that humanity will prevail even in the absence of financial incentives, and sets an example of rising above materialistic gain in a time of global crisis. So, we may say that our remarkable journey to success was founded on free health, free education, high literacy, a strong public health system, a supportive government, and of course, our renowned hospitality.
Now, we proceed to the open discussion until 3:40. Please come to the stage when the name is called. Professor Kim Chan-wan of Institute of Indian Studies from Hankuk University of Foreign Studies. Mr. Karimi Muhammad Yasser from Embassy of the Islamic Republic of Afghanistan. Ms. Sasanga Nikapithya, First Secretary of Embassy of the Sri Lanka. Mr. Kriti Das Tokchom, Second Secretary from the India. Dr. Kim Jong-gon, Director of India and South Asia Team of Korean Institute for International Economic Policy. Dr. Ji Yeon-jung, a professor from the Institute of India Studies of the Hankuk University of Foreign Studies. Please give a big round of applause to the presenters.
Yes, thank you.
Okay, please take off your mask only during your speech time and continue to wear it. I will pass the microphone to the Professor Kim Chan-wan. Thank you.
Yeah, thank you, Mr. No. Welcome to first session of Challenge of Pandemic and Global Corporations. I guess all of you did enjoy the Sri Lanka's incredible success story on COVID-19. Yes, it's quite impressed. Yes. But on Afghanistan, unfortunately, since I do not know Dari or Pashto languages, maybe you may explain. One thing really I want to know is on the video, there is saying some kind of cooperation between Afghanistan and Japan. So, but I couldn't understand what's going on. So maybe Mr. Karimi, you may explain to all of us. Okay. All right. As you know that we have 5 discussions. So first, I'm going to introduce one by one. From right side, Mr. Karimi Mohamed Asil, Consulate Ambassador of Islamic Republic of Afghanistan. And then Ms. Sangai Nikapitaya, Fourth Secretary, Ambassador of Democratic Socialist Republic of Sri Lanka. And then Mr. Kirti Das Tokchom, yes, Second Secretary, Ambassador of Republic of India. And then Dr. Kim Jong-un, Director of Indian and South Asia Team, Korea Institute for International Economic Policy. And then Dr. Ji Yeon-jung, Research Professor, Institute of Indian Studies, Hankuk University of Foreign Studies. Myself, I'm Professor Kim, Director of Institute of Indian Studies at Hankuk University of Foreign Studies. Before I start our panel discussion, let me briefly introduce our institute. Even all the presenters just introduce their own country, how they fight on coronavirus. Our institute's name is the Institute of Indian Studies, but it doesn't mean we are only covered India's. It was, our institute's name was Institute of South Asian Studies. It was Institute of South Asian Studies. And also we are publishing Journal of South Asian Studies. But we changed the names. Why? Because unfortunately in Korea, very few people knows where is South Asia. Everyone called that area Southwest Asia. Even our Ministry of Foreign Affairs, for a long time, they called that area Southwest Asia. And most of our ministry, they called that area Southwest Asia. That's why we had huge dilemmas in Korea. How to convince we are going to study South Asia. But finally, we decided, let us change our names. Institute of Indian Studies, everyone knows where India is. But historically, the South Asia means India. India means South Asia. So even though we changed the Institute of Indian Studies, still we do cover all the 8 countries of SAARC. Pakistan, Afghanistan, Nepal, Bhutan, Bangladesh, Sri Lanka, and Maldives. So all the distinguished guests who come from the Pakistan, Afghanistan, Nepal, Bhutan, Sri Lanka, Maldives, please do interact with our institute and then contribute,
whatever you can to our institute. All right, so let us enjoy the discussions and then how to tackle down the COVID-19. So first, Mr. Karimi Mohamed Ashil. Yes, please.
Well, first of all, let me to thank you, the organizer, Ministry of Foreign Affairs of the Republic of Korea, and Institute of Indian Studies for holding this very timely program. As we all are in the amid of pandemic, as Mr. Kim Jong-hyun already mentioned in his speech, that we cannot say that we overcome these challenges. Even the countries that that could control this epidemic, I think to overcome these serious challenges, we need a coordinated and integrated strategy in the national, regional, and international levels. This pandemic has two phases. One is the direct challenges to the health sector, both human being hostilities, and the other phase is the negative impacts that has on the socio-economic sectors. The two presentations which were delivered by the Afghanistan and Sri Lanka representatives from the health sectors, they focused on the national level of the strategy, that how to prevent, tackle, and combat with the spreading of this outbreak. As it was questioned that there was the name of a hospital, Afghan Japan Hospital. This hospital was already in Kabul city, part of the contribution from our friend country, Japan. Previously, it worked in the field of preventing tuberculosis. As the outbreak started since February, the hospital allocated for the treatment of the outbreak. So the main challenges for the countries like Afghanistan is, first of all, the lack of experience. The second, the lack of the medical or medication. As Mr. Fahim already said, that we had at the beginning only one lab of diagnostic test, and also the lack of the beds for treatment. So these are the main challenges, and what is very important for the countries, especially for the regional countries, is to help each other in the area of this medication, and also align their strategies on combating the outbreak. And the second point is that this outbreak has a negative impact on the socio-economic area. We need to help and coordinate the strategies how to tackle from the further of this, how to tackle the further of these negative impacts. So our government, Afghanistan government, at the first stage, started a program for the distribution of the weight for the poor community. And the second phase, because of the lockdown and because of the observation of the social distancing, the second program was to distribution of breakthrough bakeries. And right now, another program is launching under the name of Dastarkhani Milli, or the National Food Programs. This program will cover around 90% of the population through the villages, districts, and provinces. Around 280 million US dollars is allocated for this program, and it will be conducted through 2 phases. And we hope that it prevent for the furthering of these negative impacts. The other area that I want to talk about the regional, or especially about the SAARC region, that on the 15 March, the leaders of the 8 members country, they had a VTC, and they decided to establish an emergency fund on combating the COVID-19, allocated around 18 million US dollars. And after that, another VTC between the health sectors and the trade sectors. They were very positive because amid the COVID-19, which was very crucial, was the opening of the borders for trade, for the transit of the goods and supply chain. So it was very positive on that time. And the third point that I want to talk about the contribution of the Republic of Korea to the South Asia countries, or the member of the SAARC, is there are 2 ways of contribution. One is directly to the countries in terms of providing the medical equipment, diagnostic kits, personal protective equipment, or other areas, and sharing the experience of how to control the epidemic here in the Republic of Korea is very crucial. The other point that Republic of Korea can cooperate to the SAARC members is that based on the theme of the SAARC, to promote the knowledge and the experience the Republic of Korea has in the area of combating COVID-19, and also can contribute through ODA to the socio-economic development. And lastly, it will be a long-term strategy that Republic of Korea can contribute to the SAARC members in the area of trade and investment. Thank you very much.
Yes, thank you, Mr. Kamiri. Yes, of course, we do have, quite good experience to tackle down COVID-19. I guess the worldwide recognized Korea's experience. So certainly, I guess already we are sharing some kind of knowledge and experience, not only with your country, but also all over the countries. I'm not sure whether the government of Korea already sent some kind of medical equipment, including the test kit. Maybe ministry maybe have answers on that. Yes, of course, on global cooperation, you may rightly point out 2 most important points. Yes, to exchange the global equipment and also medical equipment, and then sharing of knowledge and experience. Okay, thanks so much. Since we do not have enough time, I guess all of us discussed may have maximum 6 minutes. Yes, sorry for that. Yes. And next discussant, Ms. Sangha Nipapita, First Secretary, Embassy of Democratic Socialist Republic of Sri Lanka. Yes, please. Thank you.
Good afternoon to you all, Excellencies, Professor Kim, and my dear colleagues. First of all, I would like to express my gratitude to the Ministry of Foreign Affairs for organizing this year's Korea-SAARC Cooperation Seminar on very timely topic. As we saw in the presentation, so far, Sri Lanka is successful in controlling COVID-19. Sri Lanka's cases are relatively low to compare with other countries. However, I know that as a small nation, we cannot be directly compared to our largest and much populated neighbor countries. As we are discussing today, the cooperation during the pandemic, I should say that the bilateral relations between Sri Lanka and Korea has been elevated during these difficult times. I should mention here that Sri Lanka is really appreciate and thankful to Korea for extending assistance of $300,000 to control and contain COVID-19 in Sri Lanka, to purchase test kits, masks, or any other necessary items. And one of the challenges Sri Lanka faces currently, another wave from imported cases, because Sri Lanka has over 1 million foreign workers abroad, and around 60,000 Sri Lankans are waiting to be repatriated. So repatriation process are ongoing. However, it always decides on the availability of our quarantine facilities. So I should say that the Korea immigration, our bilateral relations, employment opportunities are a major part. So we have around 25,000 Sri Lankan workers working here. So Korea immigration has extended the visas, those who have already completed their employment contracts, but waiting to go back to Sri Lanka. So it's a great relief for us as the embassy. So, and Sri Lanka government is thankful to the Korean government regarding this. Also, I would like to say that the webinar series organized by the Korean government, it was very useful, and we got very good comments from Sri Lankan authorities also. Sharing knowledge is really important in this kind of difficult situations. Also, I would like to say Sri Lanka is preparing for our general election on this coming Wednesday, 5th of August. It's actually not an easy task during this kind of pandemic, but Korea held its general elections in a very successful way. So it's the national level of elections held in the world for the first time during this pandemic. So as Korea was successful, we also wish to do it in success. As we are talking about the cooperation today, I think international cooperation is playing a major role to respond this global challenge, because most of the people are suffering from this COVID-19 are the poorest and less privileged people. So cooperation plays vital role, and I think Korea has showed how to do it in success. So I wish we could do it more and in a very fruitful way. Thank you very much. Thank you.
Yeah, thank you, Ms. Sasanga. Yes, certainly, I guess it's really important to share how to have general elections under the pandemic situations. Not only Sri Lanka situation, but even coming November, there will be the presidential election in USA. So certainly, since we have really successful story of having general election, so we can share this kind of experience with various countries, including Sri Lanka. Okay, thank you so much. All right, next speakers, Dr. Kriti Das. Yes, please.
Thank you, Professor Kim Sang-won, Director, Institute of Indian Studies, Hankuk University of Foreign Studies, and the chair of today's first session on challenges in pandemic and global cooperation. Her Excellency Mamtaz Zahra Baloch, Ambassador of Pakistan to ROK, my fellow diplomats, distinguished panelists, and ladies and gentlemen, a very good afternoon to all. I express my sincere thanks to the Ministry of Foreign Affairs and the Institute of Indian Studies, Hankuk University of Foreign Studies, for organizing this seminar at this opportune time. Before I start, I would like to apologize for not in a position to send a video presentation from a senior official from our Ministry of Health and Family Welfare. It is due to the complete preoccupation to address the ongoing pandemic in India, and I seek your kind understanding. I would start with a small brief on India's COVID story. When the pandemic started assuming global proportion, the choice every country had was to use their own strength. By recognizing our capabilities and limitations, India opted to rely very substantially on social distancing. We went for a very early lockdown and very early travel restrictions. Well before the first COVID positive cases who were returnees from Wuhan were detected on January 31, active screening had begun at airports. Restrictions were gradually enhanced, starting with travel restrictions from COVID-positive territories, followed by suspension of visas, and later banning of all international commercial flights. Our Honorable Prime Minister Sri Narendra Modi announced the nationwide lockdown on March 24. India's priority was to check the spread of virus while giving the authorities time to trace and isolate positive cases and contacts, while at the same time strengthening our medical infrastructure. Innovative steps were taken to quickly ramp up medical infrastructures, such as transforming railway coaches into isolation areas and medical centers. The Arogya Setu app was developed, which facilitated in contact tracing. The testing capabilities were ramped up through a policy of encouraging domestic production as well as import of kits. Effective coordination between multiple agencies had enabled much needed stocks of test kits, PPEs, ventilators, and essential drugs to be built up. We have developed the infrastructure fast enough to be in a position to export PPEs and ventilators now. India is currently producing around 500,000 PPE kits, 300,000 N95 masks daily. We have developed capacity to produce over 300,000 ventilators every year. Today, India has more than 11,000 COVID facilities and over 1.1 million isolation beds. As of July 31, 2020, India had an active COVID-19 case load of 567,730 people. Although the rate of increase of positive cases has risen in India in recent times, the recovery rate has also improved significantly high at 65%, with about 1.1 million recoveries in total, and have maintained a low case fatality rate of 2.13, which is much lower than the world average of around 4%. More than 30,000 patients are recovering per day for the past 7 consecutive days. Despite the size of our population, the ratio of our positive cases per million remains one of the lowest at 1,272, and that of the deaths per million remains at 27, compared to the global average of 2,316 and 88 respectively. In this context, our testing of more than 5,000 tests per day and treatment protocols seem to be effective. The testing capacity will be scaled up to 1 million tests per day in the coming few weeks. The government has also rapidly set up COVID-19 specific health infrastructure and announced a package of USD 2.1 billion for the same. Since the pandemic has hit the world, multiple forums like G20 and SAARC, in case of the South Asian region, have taken the lead in global cooperation amongst nations to fight the pandemic. SAARC provides a great platform for the South Asian region for cooperation during such pandemic. Our Prime Minister initiated the first video conference of SAARC leaders on combating COVID-19, which was held on 15 March 2020, with the participation of almost all the leaders of the SAARC member countries. It demonstrated the shared resolve of countries in the SAARC region to fight together the unprecedented challenge of the coronavirus pandemic. A COVID-19 emergency fund with an initial offer of USD 10 million by India was created to meet the cost of immediate actions. Other SAARC members also announced contributions to it, and now we have a corpus of more than USD 18 million. The SAARC Disaster Management Center have also set up a dedicated website on COVID-19 for use by the SAARC countries. SAARC video conferences between the separate agencies were held subsequently, including health professionals, trade officials, in the past few months. India has utilized its strength in the digital and the innovation technology space to develop a SAARC COVID-19 information exchange platform for use by all SAARC countries to facilitate exchange of specialized information and tools on COVID-19 among designated health professionals. Under India's e-iTech network, training of healthcare personnel in our neighborhood countries has been conducted with content delivery by super specialty medical institutes like AIIMS and PGI Chandigarh. India's humanitarian relief in the region includes supply of essential life-saving drugs, antibiotics, medical consumables, COVID protection, testing kits, and other laboratory and hospital equipment to a number of countries. Requests for the deployment of rapid response teams have been responded to promptly. RRTs comprising doctors, nurses, and paramedics, even from the armed forces, have already deployed in Maldives. The lockdown has made the logistics of this humanitarian relief operation extremely complex. However, a mixture of innovative means is being used to ensure delivery. As part of the major incoming and outgoing evacuation exercise undertaken by India globally, evacuation of nationals from SAARC countries has been facilitated. Likewise, with the help of authorities of SAARC countries under very difficult circumstances, Indian nationals have also been brought back through special arrangements. Talking about the medical assistance to foreign countries from India, India has been credited for ensuring supply of essential medicines even while meeting our own domestic requirements. Delivery of these medicines has also cemented our reputation as the pharmacy of the world and as a responsible stakeholder in global health supply chains. India provided medical assistance in the form of essential drugs, test kits to over 150 countries. Medical assistance worth around 11 million USD is being extended to over 80 countries under grants in AIDS. In addition, we granted clearance for commercial consignments about 560 million hydroxychloroquine tablets and about 1.5 billion tablets of paracetamol when these items were restricted for exports. Restrictions on exports of these medicines have since been lifted. We undertook a number of medical and early responder missions across the world. Operation Sanjeevani delivered 6.2 tons of essential medicines and hospitals consumables to Maldives. We overcame daunting logistics challenges to supply medicines and medical items to Sri Lanka, Mauritius, Seychelles, and the Dominican Republic. India also played rapid response medical teams to help Maldives, Kuwait, Mauritius, and Comoros to deal with the pandemic. In line with the Prime Minister's vision for security and growth for all in the region, and India's time-tested role as the first responder in the region, India launched Mission Sagar, under which an Indian naval ship Kesari was deployed to Maldives, Mauritius, Madagascar, Comoros, and Seychelles to deliver coronavirus-related assistance. This was the first time that a single operation covered all the countries in the region. These are some of the examples which India has undertaken to contribute in the global efforts for addressing the COVID pandemic. With this, I conclude. Thank you.
Yeah, thank you, Mr. Kritidas. Yes, certainly India is one of the major responsible countries in SAARC, no doubt. I heard that India has the largest vaccine production companies. Am I right? Correct. Yes. Correct. So, as you all heard about that, now including USA, there are some kind of, COVID vaccine nationalism going on. So even we are worse worried about that. So I would like to know that whether, since India has the largest vaccine production company, okay, so whether there is any kind of cooperation going on among the SAARC countries to share the vaccines on coronavirus if they produce successfully. Is there any official process going on among the members of SAARC to share the vaccines? Do you have any answers?
Yeah, talking about vaccine development, I want to give a small background as well. So India's progress in this pharmaceutical sector is well recognized. We have 65% of the demand of vaccines for DPT and the BCG, and 90% of measles by WHO is being supplied by India, to draw the point of India's progress in it. Indeed, Professor, India is home to more than around 3,000 pharma companies with a strong network of over 10,500 manufacturing facilities. India is also in the forefront for search for the coronavirus vaccine. In fact, we have 2 vaccine candidates as of now. The plasmid DNA candidate from Zydus, supported by Department of Biotechnology, which is the first Indian vaccine for COVID to enter adaptive phase 1/2/2 human clinical trials. The other being the whole virus platform from Bharat Biotech, supported by ICMR. One must appreciate the fact that even after the discovery of the coronavirus, it would be a Herculean task to ensure steady supply of this same across the globe at an affordable price, and this includes to SAARC. So we are looking forward for such cooperation, even with ROK as well, and even with the SAARC countries.
Okay. Thank you. Yes, what a great. All right. Next speaker is Dr. Kim Jong-un. Since you are Korean speakers, please try to emphasize on how to cooperate between Korea and SAARC countries, especially from the Korea side, on COVID-19. Thank you.
Glad to see you. It's my honor to join this seminar, and now I will speak in Korean, so for my convenience. 일단 저는 KIEP라는 한국의 국무총리실 산하의 대외 경제 정책을 연구하는 기관에 소속이 돼 있고요. 그래서 저희는 이제 먼저 한국 연구계 그리고 한국 정부가 코로나 이후에 고민하고 있는 사항을 몇 가지를 말씀을 드리고, 그 다음에 이 코로나와 관련된 남아시아 국가의 협력에 대해서 조금 말씀드리겠습니다. 일단 한국의 시각에서는 한국도 상반기에 마이너스 성장을 기록할 것이 예상이 되고, 한국 무역이 많은 한국의 입장에서는 이 코로나가 굉장히 전 세계적으로 한국뿐만 아니라 유례 없는 이런 부정적인 경제적 영향을 미치고 있다고 생각을 하고 있고요. 그래서 어떤 한국의 시각에서 보면 먼저 이 한국이 그동안 구축해온 세계적인 글로벌 생산 네트워크에 굉장히 큰 부정적인 영향을 줄 것을 굉장히 우려를 하고 있다는 점, 특히 한국 입장에서 보면 무역의 감소 같은 것들이 우려가 되고 있고, 또 이와 관련해서 인적 이동의 감소 이런 것들에 대해서 굉장히 우려를 하고 있는 상황입니다. 그래서 이 국가 간에 구축되고 있는 생산 네트워크가 어떻게 변화될 것인지, 그리고 그동안 해왔던 것들이 좀 많이 부정적인 영향을 받지 않을지에 대한 이런 고민을 갖고 있고, 그에 대해서 이제 기업들을 어떻게 지원을 해줄 것인지를 많이 고민하고 있는 상황입니다. 아마 이런 것들은 사크 국가들 사이에서도 아마 고민이 있으리라고 생각이 됩니다. 그래서 더 근본적으로는 이 코로나가 결국 이 세계 경제가 고립화 지역이나 국가 단위로 고립화되는 방향으로 세계 경제를 끌고 가지 않을지에 대한 좀 우려, 그리고 한국의 역할이 무엇인가에 대한 사실 고민을 갖고 있는 그런 상황입니다. 그리고 또 하나는 결국 이 코로나라는 게 그동안 한국에서나 또 전 세계적으로 얘기해왔던 어떤 경제의 디지털 전환, 디지털 경제의 중요성을 뭐 한국이든 어떤 나라든 더욱 중요하게 되는 이런 상황을 갖고 오지 않겠나 이런 생각을 하고 있습니다. 그래서 한국도 정부가 최근에 디지털 뉴딜이라는 정책을 내세웠습니다만 결국 디지털 인프라라든지 의료, 교육 이런 전반적인 영역에 걸쳐서 이 디지털 경제의 역할이 중요해질 것이다 이렇게 인식을 하고 있고 아마 이런 영역에서 이 사크 국가들하고 한국하고도 협력할 수 있는 향후 가능성이 있지 않겠나 하는 생각을 갖습니다. 예를 들면 한국의 경우에는 전자정부라든지 또 무역 관련해서 페이퍼리스 트레이딩 같은 그런 기술들을 굉장히 축적을 해왔고 이런 것들이 아마 사크 국가들에게 앞으로 더 도움이 되는 상황이 되지 않을까 이렇게 기대를 하고 있습니다. 코로나 관련해서 또 하나 두 번째로 말씀드리면 일단 한국은 제가 경제 쪽 하는 사람이라 자세히는 모르지만 이 메르스 이후에 특히 굉장히 그 대응 역량을 축적을 해왔고 여러 가지 기술적인 거라든지 시스템이라든지 이런 것들을 사실 상당히 축적을 해왔고 그에 따른 법적인 허들도 완화시키고 다각적으로 노력을 기울여서 실제로 이 국민의 한 사람으로 봤을 때도 상당히 그 원활한 대응을 하고 있는 중이다 이렇게 평가를 할 수가 있습니다. 그런데 이제 이 대외적인 측면에서 보면 한국이 그동안에 이 질병과 관련해서 이 국제 협력이 중요하다. 질병 대응과 관련해서 국제 협력에 대한 인식이 국민들이나 정부나 그렇게 높진 않았던 것 같아요. 그래서 결국 이 코로나를 계기로 이제 한국 정부나 한국 국민들 스스로가 어떤 국제적 공조에 대한 필요성을 깨닫고 또 우리가 국제사회에서 할 수 있는 게 뭐가 있지 않겠나라는 어떤 스스로에 대한 역량을 평가할 수 있는 계기도 됐습니다. 그래서 이런 부분에 한국 정부의 관심은 앞으로도 지속되지 않겠나 이런 기대를 갖고 있는 상황입니다. 그래서 최근에 그 코로나 관련해서 연초에 이 동남아라든지 이런 국가들의 이제 의료 물자 부족 때문에 이제 우리도 마스크를 수출해야 되지 않냐 한국에서 이런 얘기를 나왔을 때도 사실 이 좀 부정적인 의견도 있었어요. 사실은 국내적으로 국내도 모자라고 있는데 무슨 수출을 하냐 이런 여론도 있었고요. 그래서 제가 하나 사례를 들면 그래서 우리 한국이 인도네시아에 이제 저희 그 한국 기업들이 있고 의료 봉제 공장들이 되게 많거든요. 거기에 이제 마스크 원단을 제공하고 인도네시아 현지 공장에서 이 의료용 방호복을 생산해서 인도네시아 현지에도 공급을 하고 한국에도 수출을 하는 이런 식의 사업을 한 경우가 있었어요. 그래서 이게 꽤 성공적이었다 이렇게 평가를 해서 이게 나중에는 진단 키트라든지 다른 것들로 생산해서 협력하는 거로 좀 확대 중인 그런 것들이 사례가 있는데요. 아마 이런 것들도 이 사크 국가들하고 협력할 수 있는 어떤 사례가 될 수 있지 않을까 이렇게 생각하고 있습니다. 그래서 좀 끝으로 이제 ODA 뒤 세션에서도 전문가께서 말씀 주시겠지만 이 한국의 앞으로의 코로나 이후에 특히 ODA 정책이 어떻게 될 것인가를 최근에 이제 문건이 있기 때문에 제가 살펴봤는데 일단 한국 정부는 이 코로나19를 계기로 해서 개도국에 대한 보건의료 ODA에 굉장히 를 많이 강조할 것이라는 그런 방향을 밝힌 바 있고 아마 이런 방향으로 지속될 가능성이 높지 않겠나 그런 생각이 듭니다. 그래서 이제 특히 사크 국가들 가운데는 그동안 한국이 방글라데시라든지 아프가니스탄, 스리랑카 같은 국가들에게 ODA를 상대적으로 큰 규모를 지원을 해왔고 그 중에서도 이 헬스케어 부분을 많이 강조를 해왔습니다. 그래서 특히 이 메디컬 서비스 트레이닝, 인력 훈련 관련해서 많이 지원을 해준 것으로 이렇게 통계적으로 나타나고 있습니다. 그런데 이제 한국 정부의 ODA 이런 향후 계획을 살펴보니까 좀 특징적인 것이 사실 그 보건의료 자체에 대한 어떤 역량 강화에 대한 지원도 있지만은 특히 또 관련해서 이런 기업에 대한 이런 특수한 상황이 됐을 때 기업의 지원 정책 한국이 이런 관련 경험들이 많기 때문에 그런 기업에 대한 지원 정책이라든지 또 일자리, 교육, 복지 같은 이 경제 사회의 어떤 충격을 받았을 때 경제 사회가 회복하는 능력, 그러니까 리질리언스에 대한 이런 부분에는 지원을 많이 해보겠다라고 이렇게 한국 정부가 밝히고 있는데 아마 이런 부분들이 이 한국의 어떤 역할을 좀 앞으로 기대할 수 있는 부분이 아닌가 이렇게 생각을 하고 있습니다. 네, 이상으로 마치겠습니다.
Okay, Dr. Kim, thanks a lot. Dr. Kim, he pointed out very important sector which you can cooperate between Korea and SAARC country, especially the not of the digital economies. All of the SAARC countries had, great potential on digital economies, especially on manpower. So certainly, I do believe that we can have, great cooperation on digital economies, okay? Including health sectors, no doubt. Yes, of course, we are facing serious challenges on global value chains and people-to-people contact, no doubt. So we have to think about how to handle these challenges under the COVID-19 situations. Okay. Okay. Finally, Dr. Ji, yes, please.
Yes. Thank you for having me here. It's a great pleasure to be here, though the topic is very great to discuss about. And I'd like to add some of the comments next to the Director Kim on how Korean government can make a participation with the SAARC countries in prevention of the further spread of the COVID-19. First item to discuss is maybe South Korean government can make a cooperation in expanding the testing capacity with the SAARC countries, because when South Korean government was reported on the outbreak of the COVID-19 by the end of the December, I remember, then South Korean government immediately took a step to expand the testing capacity. And inter-bureaucratic coordination was the really important here, and this gives a lot of message for the countries in South Asia that inter-bureaucratic coordination for that expanding the testing capacity is the must item to consider, and South Korean government may be able to share the know-how about how to expand the testing capacity. And second item is the building a model, and this requires very active scientist-to-scientist cooperation, because when the outbreak was surged and the number of the confirmed cases for the COVID-19 was surged from the February in South Korea, then many countries located in the tropical areas were thinking that probably temperature is the major factor to prevent natural spread of the COVID-19. And to see the cases of the US, when the cases has been surged from the May, and the India's case shows that the hit number is now surged from the July, then probably that the earlier prediction and analytical model for the modeling the pattern for the COVID-19 may be wrong. And this requires very active global participation among the scientists, that what factors actually can prevent the further spread of COVID-19 and what factors may not be the major factor for the COVID-19, like temperature, humidity, or the mobility among the people may be affecting for the spread. And in case of India, relatively young country, then mobility may be very high. And some of the countries having more elderlies, then maybe mobility may be very low. So a mixture of the primary factors to monitor the COVID-19 requires a global participation, especially for the region heavily impacted by the COVID-19. The third item to discuss is that probably South Korean government can make a cooperation with many countries in South Asia that how to alleviate the public anxiety in societies. So in case of India imposes very strict lockdown from the end of March, and released partly for some part of the region, and again imposed a very strict lockdown. And some other countries in South Asia, despite that some of the countries didn't impose a lockdown, but they actively campaigned for the social distancing and self-isolation and so on. So South Korea has a similar experience earlier in this year. So probably this may be the excellent item to how to elevate the social anxiety in what way. So this is my suggestions and recommendations. Thank you.
Okay, Dr. Ji, thank you for your wonderful suggestions. Yes, certainly most of the countries in the world recognize the testing capacity of Korea on COVID-19. Yes, certainly we can share this experience and technologies and know-how with the countries in SAARC. Yes, that's true. Since we do not have enough time, I don't think we can give a chance to Flo to write some questions or comment. Yeah, as you know that government Korea is pursuing new southern policy. All the members of SAARC country are part of the Korea's new southern policy. So I do believe that Mr. No may inform all the important comment and the suggestion to the government of Korea how to cooperate between Korea and SAARC on COVID-19. Will you? Would you? Yes. Yes. All right. Thanks so much. Okay. Thank you. Thank you very much. Okay.
Thank you, Mr. Kim. This is the end of the session 1, and I hope this session was very meaningful time to you. Thank you for the chair, speakers, and panelists. Oh, can you? Now we proceed to the session 2. In a minute. Now we proceed to the session 2, Challenges of Pandemic and Global Cooperation. The session starts with the first presentation by Ms. Farhana Ahmed Chaudhary, Director of SAARC and BIMSTEC Wing of Ministry of Foreign Affairs from Bangladesh.
Excellencies, distinguished delegates, ladies and gentlemen, a very good afternoon to you all. I am very pleased to participate in the 11th Republic of Korea-SAARC Partnership Seminar. The theme of this year's seminar, ROK-SAARC Cooperation on Public Health and Poverty Alleviation in the Time of COVID-19 is very timely, relevant, and appropriate. The seminar will surely help us to explore the ways and means as to how we may respond to the adverse impacts of COVID-19. At the outset, I would like to express my sincere thanks to the Ministry of Foreign Affairs of Republic of Korea and Institute of Indian Studies of Hankuk University of Foreign Studies for organizing this important seminar. I would further express my deep appreciation for giving me this opportunity to contribute to the webinar even from a considerable distance. Today we are meeting at a crucial point for human civilization. Our very dear world is severely hit by COVID-19, an invisible enemy with incredible power. It is evident that by leading to global recession, COVID-19 is going to leave all-pervading impacts in the SAARC region. It's not merely a global health crisis, but a grave socio-economic turmoil translating into reduced employment, increased poverty rates, aggravated food security issues, growing social discrimination and inequalities, etc. As this pandemic unleashes its dreadful form, it is imperative for us to decide on the comprehensive strategies to contain this deadly enemy. And here comes the critical importance of the role of regional organizations like SAARC that covers 21% of world population and 4.21% of the global economy. I firmly believe that these seminars will facilitate greater exchange of information and fruitful discussion on deeper cooperation of SAARC with Republic of Korea, which has successfully contained COVID-19 in its own country. In combating COVID-19 in a well-prepared manner, the two areas of cooperation as mentioned in the theme of today's seminar, namely public health and poverty alleviation, are of utmost importance. As this pandemic has exposed the limitations in the health sectors of various countries, it is high time that we address them in a timely manner. It is important to ensure greater access of our people to uninterrupted healthcare service. In the same way, it is crucial to build economic resilience in the SAARC countries by alleviating poverty. Poverty alleviation is a cross-cutting issue which is critical for all the SAARC countries. In this regard, various joint actions or initiatives in the form of project-based collaboration on the said sectors can further consolidate SAARC-ROK cooperation and strengthen our collective efforts in combating COVID-19. As a regional forum, SAARC is strongly committed to promote the life and livelihood of the inhabitants of SAARC region. SAARC's response to COVID-19 global pandemic was timely too. Following the outbreak of the global pandemic, at the urgent call of the Prime Minister of India, the SAARC leaders video conference took place, where the leaders agreed to enhance cooperation to combat COVID-19. The objective of the video conference was to decide on the comprehensive strategies and action plan to combat the COVID-19. As a consequence, SAARC Emergency COVID Fund was established and a series of virtual meetings, including the meeting of trade officials and health professionals, took place. It has been well realized by the SAARC member states that being a global crisis, only a coordinated approach can be helpful in tackling the multifaceted challenges of post-COVID-19 era. In this regard, the possible cooperation from the SAARC observer states like Republic of Korea can definitely strengthen SAARC initiatives against global pandemic COVID-19. Bangladesh always values South Korea's constructive contribution and engagement in SAARC. We appreciate Republic of Korea's special training programs annually organized under Korea's cooperative projects to SAARC since 2008. It's very effective as it plays significant role in building capacity of the participants from SAARC countries on various vital areas. We also commend ROK initiative to organize SAARC Partnership Seminar every year. It's a unique platform for the exchange of experiences and ideas to identify concrete ways and put forward policy recommendations for further enhancing Korea-SAARC cooperation. It is heartening that with the passage of time, cooperation between Korea and SAARC countries has been reaching its height, especially on economic and development cooperation fronts. We would like to encourage ROK to come up with further result-oriented initiatives and project-based cooperation in SAARC priority areas in current perspectives like public health, economic cooperation, agriculture, energy, connectivity, environment, communication, etc. Distinguished delegates, we all are aware that Republic of Korea is in possession of essential skills, latest technologies and outstanding professionals in both public and private sectors. It has also the rich experience of establishing hospitals and disease control programs successfully. We believe in our fight against COVID-19, Republic of Korea's outstanding success in the fight against coronavirus is a beacon of hope. Moreover, South Korea's valuable experience in curbing COVID-19 transmission through test, trace and treat formula is well acclaimed. It was evidently a challenging mission to detect the COVID-19 cases early with large-scale diagnostic scanning and meticulous epidemiological studies. Moreover, successful application of expensive high-tech contact tracing mechanism and ensuring 100% public access to healthcare service are some unique achievements of Republic of Korea in public health sector. Without imposing strict lockdown measure, such drastic decline in COVID-19 contagion is exemplary. In line with successful strides by South Korea in the battle against COVID-19, various effective project-based collaboration with SAARC countries is welcomed by Bangladesh. Moreover, as a committed partner of SAARC mechanism, South Korea may also come forward to share technical know-how, expertise and best practices in public health sector and facilitate capacity building of the SAARC member states. Trainings for the healthcare professionals and health service providers can be very helpful. In the face of such unprecedented crisis, South Korea may come forward to support the SAARC member states by providing high-tech medical equipment, testing kit, etc. In addition to the above, SAARC states can also get the benefit of ROK's expertise in establishing medical centers and disease control programs. Along with enhanced SAARC-ROK cooperation in public health, the importance of amplifying solidarity for consolidated cooperation in poverty alleviation can enable us to address the far-reaching impacts of COVID-19. Poverty alleviation should be an important cornerstone in post-COVID recovery plans. In this regard, relevant projects on creation of employment, expanded social safety net for the vulnerable people, enhanced food production through use of ICT, trade facilitation projects, energy efficiency collaboration, projects on promoting gender equality and women empowerment, growth of resilient infrastructure, strong disaster risk reduction programs, and resilience building against climate change impacts, etc., may be envisaged. It will be imperative to minimize the widening inequalities induced by COVID-19 pandemic by putting in place inclusive systems. All the pragmatic collaborative measures should be taken to continue the progress on achieving SDG goals. To conclude, extraordinary situations demand extraordinary measures. We, the SAARC member states, in collaboration with the observers states, should not fail to adopt extraordinary measures in the face of deadly pandemic COVID-19. In this regard, there is no alternative to innovative policies and coordinated response. It is only through collective measures and wider cooperation we can face the deadly pandemic of COVID-19. Bangladesh deeply appreciates the ROK government's sincere commitment to collaborate with SAARC under its new Southern policy that aims to promote co-prosperity with the South Asian region. We believe together we can combat COVID-19 pandemic successfully. Bangladesh looks forward to continuing this amazing journey with Republic of Korea as close partners, both bilaterally and multilaterally. Thank you very much for your patience here.
Thank you, Ms. Farhana. Next presentation will be presented by Ms. Saad Aishat, Deputy Director General of National Planning and SDGs Coordination of Ministry of National Planning, Housing and Infrastructure, and Ms. Aminat Shafa, Director of Public Health Programs, Health Protection Agency of Ministry of Health from Maldives.
Maldives has always battled with its fair share of social, economic, and climate vulnerabilities for decades. COVID-19 proved to have compounded and added to these tribulations. On 30th January 2020, WHO has declared the outbreak of COVID-19 a public health emergency of international concern. In light of the accelerated international spread, severity and growing mortality rate of the disease, WHO declared a pandemic on 11th March 2020. Maldives' efforts to combat the pandemic health emergency preparedness began at the Ministry of Health in response to COVID-19 as early as January 2020. Health Emergency Operation Committee was convened in early February 2020, followed by Health Emergency Coordination Committee, which included the relevant stakeholders. On 7th March, Maldives reported its first case of COVID-19, and in response to the global pandemic, the government of Maldives imposed travel restrictions from various countries that were affected by the disease. On March 12, state of public health emergency was announced in Maldives under Section 33 of the Public Health Act 7/2012 for a period of 30 days, and this has been extended since then. With the declaration of public health emergency, a contingency budget was allocated by the Ministry of Finance and the emergency reserve funds were mobilized. National Emergency Operations Center was established, co-chaired by the Minister of Health and Minister of Defense, Republic of Maldives, to oversee the activities of stakeholder agencies. All operations and decisions regarding the pandemic were later tasked to them, which was overseen by the President and the Cabinet, coordinating and monitoring daily operations, which allowed the government to make timely decisions. National Disaster Management Authority and Health Protection Agency were designated to coordinate this nationwide multi-sectoral effort in COVID-19 response. Technical Advisory Group was also formed to provide technical guidance to the operation centers during COVID-19 response. His Excellency President of Maldives regularly reviews COVID-19 situation at the task force and cabinet meetings and continues to guide and reassures the public regarding actions to protect and safeguard all living in the country. National Emergency Preparedness, Readiness and Response Plan for COVID-19 was developed, and the plan included an emergency was graded into 4 levels nationally. The country was also divided into 6 different zones. Each zone was graded separately for engaging preparedness and response. Currently, the public health alert level is 2, that is yellow, whereas in the capital city, Malé, the alert level is 4, it is in red. The emergency declaration has allowed the government to introduce a series of unprecedented restrictive and social distancing measures, including stay-at-home orders in capital Malé, a ban on inter-island transport and public gatherings across the country, and the nationwide closing of government offices, schools, colleges, and universities. Focus was also given to a nationwide awareness campaign and timely provision of information to media via regular press conferences. Resources were reallocated from non-priority capital projects towards combating the health pandemic, and government spending was reduced. COVID-19 proved to be not only a health catastrophe but an economic catastrophe too for the Maldives, like many other countries. With repercussion of COVID-19 was felt immediately across sectors for tourism to trade, the COVID-19 crisis impacted livelihoods of many, hitting the most vulnerable and the hardest. Maldives has been swift in its response to the COVID-19 pandemic, with early implementation of a partial lockdown and other public health measures, including early testing, tracing, isolating, and treatment of positive cases, training to deal with the new pandemics and to create awareness among concerned agencies, and to provide timely and relevant information and updates to the public was among timely steps taken. Extensive contact tracing and quarantine of contacts prevented an exponential rise in the number of cases. The country is among the worst affected globally during the crisis, which saw impacts on global travel as well as strict and containment measures put in place locally. the tourism industry completely closed for 3 months, a move unprecedented in the country's history. Tourism sector was largely affected as it accounts for 2/3 of the island's nation's GDP. An estimated 45,000 employees lost their jobs in the tourism industry, out of which more than half were expatriate workers. The second most affected sector was construction, employing 40,000 to 50,000 expat workers and 5,000 to 7,000 locals. COVID-19 pandemic has resulted in decrease of government revenues, hence adequate funds for health is being mobilized to protect the population from financial catastrophe and impoverishment associated with use of healthcare services. Relief support was offered for big and small businesses, freelancers and others, including cost-cutting measures were in place on public expenditure. Strong monetary policy and exchange rate stabilization was put in place. Utilities bills were subsidized across the country up to 30%. Diesel and food prices inflation controlled. Care packages containing essential goods and foods were distributed to those in need, including migrants. Economic diversification was seen as a crucial, and focus was also given on fisheries and agricultural sector. The border opened on 15th July with restrictions of mandatory home quarantine for the Maldivians work permit holders and also their dependents who were coming up from abroad. The Maldives government has taken important steps to establish quarantine and isolation facilities and prepare hospitals for testing and treatment. Migrant workers are among the vulnerable and marginalized group within the country, further spiraled into conditions of grave economic and social issue due to COVID-19. Among them who are suspected or positive for COVID-19, all mechanisms for medical evacuation to a quarantine or isolation facility was arranged by the government of Maldives. The migrant workers' population is a vulnerable cadre as most seems to live in congested, shared quarters, and most of the time the kind of work they do makes physical distancing difficult to practice. Their living conditions could lead to COVID-19 outbreak amongst them, overwhelming the country's already overstretched response to contain the disease. Although employers are obliged to provide migrant workers with health insurance coverage, however, it is seen at times that this is not abided. Also, fear of arrest, detention, and deportation may have been an unprecedented effect on them. Hence, the government quickly took firm measures to mitigate the issue and declared free testing and treatment for all migrant workers, even for those who were undocumented. Despite the efforts, COVID-19 cases spread and rapidly increased within the large migrant worker community in capital Male. Hence, with the help of Ministry of Economic Development and Maldivian Red Crescent, support was provided to the migrant populations. A migrant support center was established by MRC to provide the required support to migrants experiencing economic hardship and living in difficult circumstances, especially due to the lockdown measures that were put in place. As part of these efforts, crowded residents of migrant workers were identified and relocated and initiated to other temporary accommodations with provisions of food, hygiene kits, facilitating healthcare services, and also providing support via a migrant helpline service. On March 11, the government established a dedicated COVID-19 clinic for migrant workers in Greater Male. The clinic allows consultation irrespective of work permit or undocumented status. As a result of the crisis, these mechanisms are not operating to their full capacity. Adding on to their burden, the workers' countries of origin have been reluctant to take them back in large numbers because of domestic fears of new infections. The government has been facilitating repatriation flights for those stranded, mostly migrant workers, due to the travel restrictions. The financial impact on migrant workers will continue to reverberate even as the economy reopens. This will impact both an individual catastrophe for the migrant workers and the family members back home in terms of loss of income for education, healthcare, and sustenance on a very broad scale. Risk communication, use of social media platforms as means of disseminate timely information and advocacy materials developed in multiple languages to reach a wider audience, including foreigners and migrants, and regular analysis was done to understand communication needs or issues. Lessons learned from the COVID-19 crisis has further highlighted the many issues that migrant workers are facing in the country, and these have been lingering for a very long time. The government sees this as an opportunity to find a solution to these issues, and the MOLD is working on ensuring that the negative socio-economic impacts of COVID-19 is an opportunity to build back better and to ensure that development progress leaves no one behind. As of 21st July 2020, Maldives has reported 3,044 confirmed cases, which includes 1,311 locals and 1,733 foreigners of COVID-19, out of which 2,397 cases are fully recovered and have 15 deaths. Thank you.
Now we proceed to the open discussion. Please come to the stage when the name is called. Please give a big round of applause to the presenters. Professor Cho Hae-rim, Adjunct Professor from Graduate School of International Studies of Ewha Women's University. Mr. Samuel Murmu, Second Secretary from Embassy of the Bangladesh. And Ms. Kim Sun-ae, a Director of Department of Evaluation and Research from Korea Foundation for International Healthcare. And Professor Rajiv Kumar, a research professor from Institute of Indian Studies of Hankuk University of Foreign Studies. Please give a big round of applause to the panelists. Please take off your mask only during your speech time and continue to wear it. I will pass the microphone to the Professor Cho Hae-rim. Thank you.
Thank you very much, Mr. No from Ministry of Foreign Affairs. A very good afternoon to all of you. It's a very new way of doing a seminar like this. As introduced, my name is Hae-rim Cho, and I teach at various universities, actually, including Ewha Women's University. And I also work for part-time for the Korean Institute for Gender Equality, Promotion and Education. So I'm partial in the public sector, this part in the private sector. I'm very pleased to chair this very important session, as we are a little bit behind schedule. I will proceed to introduce our speakers. Well, actually, to very briefly introduce myself, I am actually an ODA specialist, working in the area of development cooperation. So I do work closely with Asian countries and people, including some countries in SAARC, but I've never been to this particular regional communication forum, so it's a great pleasure. Okay, we have 3 discussions today, and it's much fewer than the previous sessions, but I was told that we only have 20 minutes, so I would say we have about 5 to 6 minutes each to present. Let me introduce. Please excuse me if I don't pronounce your name correctly. Mr. Samuel Murmu is over there, right? Second Secretary of the Embassy of People's Republic of Bangladesh. And then we have Dr. Kim Sun-ae she's the Director of Department of Evaluation and Research of the Korea Foundation for International Healthcare. And then we have Professor Rajiv Kumar. Yes, he is a research professor at the Institute of Indian Studies at Hankuk University of Foreign Studies. So, without further ado, can we start with Mr. Samla Murmu, please?
Thank you, Professor Cho. Excellency, dear colleagues, ladies and gentlemen, at the very outset, I would like to extend our sincere thanks to the organizers for arranging this event amid the global pandemic of COVID-19 and for giving us the opportunity to discuss this timely and pertinent issue. It's needless to say that this pandemic has affected the rich and poor, the developed and developing countries alike. Due to this pandemic, each and every day we are losing precious human lives. It has also posed huge challenges to our public health system with socioeconomic fallouts like growing social discriminations, inequalities, unemployment, minimizing expenditure for food and clothing, and the list go on. The scientists are also predicting that there will be a second wave of COVID-19 coupled with influenza in the coming winter, and more deadly viruses than COVID-19 may come in the coming years also. Under such scenario, no country or region can single-handedly counter these ongoing or future pandemics. Therefore, there is no alternative to global or regional cooperation to counter and contain these pandemics effectively. And Bangladesh has always welcomed this kind of joint efforts. It believes that the endeavors of the SAARC member states and its observer states can make a difference in handling the multifarious impacts of COVID-19 and thus contribute towards the betterment of the people in this region. Bangladesh has been addressing the adverse impacts of the climate disasters or major humanitarian crises with resilience to fight those crises. Other than the bird flu, this pandemic is the first such experience for Bangladesh, which came with a completely different magnitude. So with no previous experience of such nature, Bangladesh tried to address this situation with initial lockdowns and social distancing. In the meantime, it has also enhanced the capacity of its health sector in terms of testing, increasing the number of hospitals, beds, and skill developments for its health professionals. It's now producing quarantine products like the personal protection equipment, masks, ventilators, including the generic version of remdesivir for treating COVID-19, which is offered at the government hospitals in Bangladesh for free. It's also exporting such items to the developed and developing countries as well. Its homegrown pharmaceutical companies have made detection kits and negative pressure machines, but yet to be examined by the World Health Organizations. So at present, Bangladesh is gathering experience and knowledge from other countries like the Republic of Korea to fight the spread of this virus effectively. You may all agree that the Republic of Korea has set an example for the world by containing the spread of COVID-19 effectively without imposing any strict lockdown measures. Its extraordinary approaches can serve as a base lesson for the rest of the world as well. And its past experience with the outbreaks of virus-borne diseases like MERS and SARS helps the country to take appropriate measures to fight this pandemic effectively. So since the Republic of Korea has extensive experience and expertise in containing COVID-19 successfully, so it may play a leading role in the SAARC region in containing the spread of the COVID-19, as well as developing public health systems as well. So in this regard, in the public health sector, Korea may offer training and capacity building programs, as well as best practices for healthcare professionals and health service providers of the SAARC region. Also, it may transfer its technologies and technical know-how, including its expertise in establishing healthcare facilities and healthcare centers in the SAARC region. It may also consider providing high-quality medical equipment and quarantine products to the SAARC member states at a competitive price. So, extraordinary situations demand extraordinary measures. So, we all are in the situation together, and we must support and cooperate one another in whatever way possible to come out of this situation collectively. Thank you all.
Thank you very much, Mr. Mumu. I think you echoed the presentation from Madame Farhana when she really stressed the importance of cooperation within this very unique regional platform. And if I remember correctly, she stressed that there should be more concrete ways to collaborate rather than just discussing this together on a table. She proposed project-based cooperation and PPP, public-private partnership. And of course, Mr. Mumu, you echoed that there are many things to share from Korea. But please remember that Korea had a point when we did not have any experience at all, too. So we all learn from any point. We start learning there, and we can share our learnings. I think that is the value of having sometimes bad experiences, but good ones, good bad examples. So thank you very much. Next, we will move to Dr. Kim Sune, please.
Thank you very much for having me today to have discussed this important seminar. I will talk in Korean. 저희가 경험하지 못한 아주 특별한 질병에 지금 직면해 있고 전 세계가 그 문제를 해결하기 위해서 아주 열심히 노력을 하고 있는 걸로 알고 있습니다. 그래서 저희가 이제 그 코비드 19이 발생을 하고 나서 현재까지 어제 저녁에 제가 찾아본 바로는 1,800만 명이 발생을 했고 전 세계적으로 그리고 약 70만 명이 이미 사망을 했습니다. 굉장히
I'm very sorry. I should have reminded you that the handout is in front of you.
I prepared my presentation.
네.
그리고 많은 나라들이 같이 노력을 하면서 공동으로 이 문제를 해결해 나가기 위한 아주 중요한 시점에 있다라고 생각을 하고 있고 무엇보다도 전 세계적으로 보건이 헬스가 아주 프라이어리티로 오른 거는 이 팬데믹을 계기로 해서 굉장히 많은 네트워크와 노력이 필요하다는 것, 글로벌 노력이 필요하다는 공통점에 도달해 있는 걸로 알고 있습니다. 그리고 이제 이 팬데믹을 헤쳐나가기 위해서 많은 나라들이 행했던 두 가지 방향이 있었습니다. 메디컬적으로 메저해서 이쪽에 인터벤션 들어가는 거, 예를 들어서 약이나 백신 개발이나 이런 쪽으로 가는 메디컬 쪽으로 가는 방향과 그리고 넌 메디컬 그 카운터 메저로 여러 가지 방법들을 썼습니다. 인포메이션을 전달하고 그리고 커뮤니케이션하고 또 소셜 디스턴스를 늘리고 또 뭐 어딜 가나 방역을 하고 소독을 하는 그런 오늘 우리가 손 소독제가 다 있는 것처럼 그렇게 가는 방향 하나하고 또 한 가지는 트랜스미션을 줄이기 위한 노력이 또 있었고요. 그리고 그 증상이 발현하고 그 사람이 무증상인 경우에도 이미 전파를 하고 있는 경우들이 많았기 때문에 이 갭을 줄이기 위해서 증상이 없어도 그 사람들이 빨리빨리 진단할 수 있는 것과 그리고 그 사람들을 격리하는 그런 방법론 그리고 또 여행을 제한하는 그런 것들이 두 가지 방향성을 가지고 전 세계적으로 행해지고 있는 상황입니다. 그리고 많은 나라들이 실제로 자기 나라의 그 보건에 관련된 리소스를 아마 파악을 하게 되는 어떤 계기가 됐을 거라고 생각을 합니다. 그래서 얼마나 많은 보건 의료 인력이 있었고 어떤 설비들이 갖춰진 병원들이 있었고 보건소가 있었고 이런 것들에 대한 다양한 그 보건 시스템에 대한 형태를 돌아보는 그런 계기가 됐다라고 생각을 하고 있습니다. 그래서 초기에 그 코비드가 발생을 했을 때 선진국과 후진국 또는 개발도상국과 개발이 된 국가의 구분이 모호해지는 상황도 잠시 경험을 했었습니다. 그래서 아마 이 상황이 진전이 되고 조금 완화가 되는 상황에서는 많은 나라들에서 헬스 시스템을 어떻게 가져갈 것인가라는 그런 고민들을 할 거라고 생각을 하고 있습니다. 그래서 그 정답은 아직 없지만 그 보건 시스템, 헬스 시스템이 강한 나라일수록 이런 다양한 리소스와 자원들을 적절하게 분배해서 문제를 해결해 가는 방향으로 간다라고 볼 수 있을 것 같습니다. 그리고 저희가 이제 코로나 이전과 코로나 이후로 크게 구분을 해서 많은 분들이 얘기를 하고 있습니다. 코로나 이전과 이후가 뭐가 달라졌을까를 생각을 했을 때 근본적인 문제는 똑같다고 생각을 합니다. 근본적으로는 health is a fundamental human right. 그러니까 인간의 당연한 권리이고 당연히 시스템이 중요하고 그리고 우리는 UHC를 달성하기 위해서 노력을 하고 있고 또 2030 SDG를 달성하기 위해서 노력을 해왔습니다. 그러나 이 코비드 상황이 되면서 저희가 한 가지 더 강조하고 이렇게 인식하고 있는 것들은 그 헬스 시스템 강화와 더불어서 이 문제는 한 나라의 문제가 아니고 한 지역의 문제가 아니라 글로벌, 리저널, 내셔널 코퍼레이션이 너무 중요하다. 이런 그 어떤 공통점에 도달해 있는 것 같습니다. 그래서 이 문제를 향해서 아마 모든 국가들이 같이 협력해 가는 방향으로 가지 않을까 생각을 하고 있고요. 그리고 한국에서 우리는 이제 지금 한 6개월, 7개월의 경험을 통해서 많은 그 석세스 또는 좀 어려움, 한계점 이런 것들을 경험을 했기 때문에 이거를 한번 정리를 해봤습니다. 그래서 석세스 할 수 있었던 어떤 팩터들을 봤을 때 처음에 잘 준비가 되어 있었던 거는 저희가 메르스라고 하는 아주 큰 질병에 한번 팬데믹이 있었기 때문에 우리나라에서는 그 여러 가지 행정적인, 법률적인 그런 정비가 있었습니다. 그래서 로와 또 레귤레이션, 가이드라인 이런 것들이 많이 정비가 되면서 이 코비드가 발생을 했을 때 바로 대처할 수 있었던 아주 좋은 그 사례가 될 수 있을 것 같고요. 그리고 매일 오후 2시가 되면 그 KCDC의 본부장님께서 저희에게 모든 국민에게 생방송으로 커뮤니케이션을 했습니다. 어떤 상황이었고 그래서 어떤 조치를 할 거고 그리고 여러분들이 행해야 될 거는 어떤 거다라고 아주 키 메시지를 클리어하게 매일매일 전달을 했고요. 때로는 굉장히 힘들어 보이고 때로는 좀 똑같은 메시지이지만 그걸 강조하는 그런 것들이 있었고요. 또 한 가지는 저희가 충분히 그런 자원들에 대해서 빨리빨리 대처할 수 있도록 그런 여러 가지 체계들을 만들었던 것 같습니다. 그래서 부족한 병상은 다른 지역에서 조금 백업을 할 수 있는 그런 시스템도 가져올 수 있었고요. 그리고 또 한 가지는 저희가 이제 전국민 건강보험이 있어서 그런 헬스 파이낸싱 문제를 많이 해결할 수 있었고 그 건강보험을 토대로 해서 구축해 놓은 다양한 시스템들을 활용해서 뭐 마스크를 빨리빨리 공급하고 모든 국민이 다 가져갈 수 있도록 골고루 분배할 수 있는 그런 시스템을 가져올 수 있었고요. 그리고 퍼블릭 프라이빗 파트너십을 통해서 공동의 노력을 해왔던 그런 부분이 있었습니다. 그리고 각 질병의 양상, 전파 속도, 전파 양상에 따라서 각각 다른 어떤 대처 방안들이 매일매일 또는 일주일 단위로 업데이트가 됐기 때문에 그게 아주 클리어한 커뮤니케이션, 리스크 커뮤니케이션과 같이 왔기 때문에 조금은 성공할 수 있지 않았을까. 그리고 우리나라 보건 시스템 중에서 이제 보건소나 보건지소 또는 지자체가 이렇게 이제 코비드 상황에서 굉장히 중요한 역할을 하면서 같이 협력을 했기 때문에 성공하지 않았을까 하는 생각을 해봅니다. 그래서 이렇게 한번 정리를 해볼 수 있을 것 같고요. 여러분들이 말씀하신 것처럼 이런 감염병이나 긴급한 상황에서는 분명히 vulnerable population 또는 어떤 취약계층들이 다양한 혜택에서 배제될 수가 있기 때문에 그 문제에 도달을 하게 되면 저희가 이 퀄리티의 문제를 제기하지 않을 수가 없고 이 문제가 아마 백신이 개발돼서 모든 전 세계 모든 사람들에게 백신이 투여되기 전까지는 이런 문제들을 같이 고민해야 되고, 이게 단순히 한 사람, 한 국가, 한 지역의 문제가 아니라 글로벌하게 같이 고민해야 될 문제로 생각을 하고 있습니다. 그래서 저희가 이 코비드 상황에서 앞으로 같이 경험을 공유하고 서로 잘했던 점, 또 실패했던 점, 어떤 제한점들을 같이 공유하는 자리가 무엇보다 중요할 것 같고요. 그리고 이런 네트워크를 통해서 공동 문제를 해결해가는 그런 리더십과 그리고 가버넌스가 무엇보다 중요할 것 같습니다. 그래서 저희가 생각하는, 이제 저희는 코피는 보건의료 ODA를 하는 기관으로서 저희가 생각하고 있는 거는 긴급으로 어떤 상황에서 대처하는 거는 긴급적으로 대처를 하겠지만, 상시적으로 어떻게 이런 감염병, 우리가 어떤 감염병이 앞으로 올지 모릅니다. 그래서 이머징하거나 또는 리이머징하는 인펙셔스 디지즈를 대비하기 위해서 같이 노력을 하기 위해서 정책이나 행정, 입법, 그리고 예방이나 감시, 그리고 진단, 검사, 치료, 관리, 이런 다양한 분야가 저 위에 있는 하이 레벨부터 지역 주민에게 비헤이비어 체인지까지 갈 수 있는 탑다운 또는 바텀업이 같이 믹스되는 하이브리드 될 수 있는 그런 방향으로 ODA도 가야 될 것 같다라고 생각합니다. 네, 감사합니다.
Thank you very much, Dr. Kim. What a comprehensive account of issues around health system strengthening. Of course, Korea has many successful stories, but among them, I really wanted to stress again the way that we communicated to our people every day by KCDC officials. I think building trust in this very difficult time is a must amongst the key, the successful factors. Other very important issues were raised, but I definitely agree with you that this should be entrenched in our everyday life, not only during pandemic, but really equality, so that we do not leave anyone behind in this difficult time. It's not just the right thing to do, but it's certainly a good thing to do for all of us. So thank you very much for that very comprehensive account. Now, finally, we will move to Professor Rajiv Kumar. Please take the floor.
Thank you. I am Rajiv Kumar. I am working as a research professor at Institute of Indian Studies, Hankook University of Foreign Studies. My research focuses on political economy and international relations. So I will try to draw a big picture of COVID-19 and how it's going to impact, how it's impacting a relation between many nations, and how Korea is relevant for SAARC country and South Asia. Let me briefly start the before COVID era. Before COVID era, there was growing talk about Asian century, that the 18th century and 19th century belongs to Europe, especially Britain. 20th century belongs to US, but many predicted that 21st century is going to be for Asia. And of course, so many arguments, economists, political scientists, all were drawing a big map that how really Asia a shared prosperity, that every country are going to emerge and going to lead the world economy. And SAARC and South Asia was key to that 18th century concept. Why? Because before the COVID era, SAARC countries was really witnessing rapid economic growth from 8% to 7%, India 7%, Bangladesh, it's about 8 to 9% recently, even Pakistan 5%. So this huge economic shift was going on. Even last year when I presented here, I make a small comment that we all talk about the rise of China, but I put a hypothesis that South Asia in the next 25 years is going to be next China, because the overall economy will be equal to just like China. So we have to understand this region in a comprehensive way. But COVID-19 came, and we all know that what's happening. Recently, World Bank made that COVID-19 it's not just small or minor impact, but it's great transition. What our project and Professor Kim also mentioned that it's a great transition. Why? Because what South Asia witnessing right now is the big recession. It's not just minor. It's 40 years. Last 40 years, we haven't registered such type of growth rate. It's 1 to 2%. Think about countries like, many countries like Maldives, even Pakistan, even I think Nepal, they are registering the -2%, -4% growth rate. So recovery is really, it will take so much time. Apart from that, South Asia, we know that still, even though the economic growth rate was there, poverty is there. Unemployment is rising. And what new concept is emerging? The lockdown generation. That means those who are in the 20s and 30s and they were supposed to enter in the job market in this next 2 to 3 years, but they are not sure about the future, whether they will get the job or not, or whether their whole life is going to be impacted due to this 2 or 3 or 1 year of this pandemic. So a huge impact is going to be there. Even though they will get the job, but they are not going to get paid as they might have got previously. So huge impact is this. So recovery is tough. Now, what is more important from geopolitical perspective is that, of course, we are having the pandemic. It's a very much big medical crisis, but it's also a big geopolitical crisis. No, it is expected that the crisis will bring cooperation, but what we are witnessing right now is that the crisis has brought another crisis. No global cooperation is happening. We are all witnessing the US-China conflict at this stage when the world needs really great cooperation. At the same time, not only at the global scale, but in South Asia, we are also witnessing big challenges in geopolitics. So many conflicts are emerging, so many geopolitical tensions are going on. That's very much an unfortunate story at this time. So experts are saying at the moment is it's a big shift, great transition. That what we are saying before, that Asian century is not Asian century now. Asian century is going to be the Chinese century. Because I think last week, many were predicted that the Chinese economy will down, but China registered more than 3 to 4% growth rate. Comparing to that, other economy in Europe, US, all are struggling rapidly. And even, of course, South Asia is also struggling. And also due to technological war and trade war, so many are saying that it's not just the Asian century, it might be going to be the Chinese century, and others have to just accommodate and understand it. So these are the emerging challenges in front of us. So what is for South country and how Korea is a key player? Now I will come on policy recommendation. What we need to do at this stage is really, we need to concentrate on economic development. We need to focus on how to tackle this really a big pandemic at this stage. Not to indulge in any type of geopolitics at this stage, because that will hurt millions of billions of people in that region who might have a better life, better opportunity. Now, and also not to take a side. Of course, geopolitical tension is going on. What Asian can do is, especially Southeast Asian can do it, not to take a side. So why Korea is important? Another thing, I will give you a geopolitical reason for that. We South Asian are really right now getting so much support from various Northeast Asian countries, from Japan, from China at this stage, and some video we saw that Japan also doing something, China also doing something. But if you see from this region perspective, there is competition between China and Japan to influence South Asian country. But Korea is a country which have no political intention in the region. It's a very natural player, very, very natural player. So whatever we develop with Korea, it's very, 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 very natural. Also, we are witnessing a new things, nationalism growing on in this region, that many countries are really pursuing a big agenda while considering nationalism. But on the other hand, Korea is a country which is not, big support of nationalism, but on the other hand, they are supporting liberal order. Recently, when Korea has announced a global funding for vaccine development, and also when G20 meeting was held, it was Korea who said that at this time of crisis, we need to have global cooperation. We need to send businessmen to other countries. We need to have flow of exchange. So that type of liberal approach Korea is having. On the other hand, we are witnessing lockdown approach or containing so much flow. So Korea is very significant for South Asia from this perspective. And as I mentioned that SAARC country need to focus on recovery, economic development, not to indulge in any type of political rivalry. Thank you so much.
Thank you very much, Professor. Indeed, a big picture, and thinking about where we should be heading so that we know what we should be doing today, right? And in terms of that, thank you for giving us some policy recommendations. Thank you very much. I think also that was something that was connected to what Maldives said in their presentation about how they have been severely affected by tourism, by the halt of traveling, and stating that this is not only a health catastrophe, it's an economic catastrophe. And areas such as, or countries like Maldives are heavily affected by this, the industry of tourism when such kind of situation occurs. So I remember Madame stressed the importance of economic diversification, if I may connect to that, because we did not address to their presentations. Okay, so I guess that is the end of the second.
And all the panelists, please come down from the podium.
Research methodology textbook? No. Oh, your name is so familiar.
We're going to have a break from now on until 5. Until 5 minutes. Coffee and refreshments are ready in the back of the venue. We will see you all at 17:05. Thank you. May I have your attention, please? Now we are going to have the session 3, Cooperation on Poverty Alleviation. Because of the time constraints we face, we will play the video in a more faster way. So just keep in mind. Okay, we will start the session 3, Cooperation on Poverty Alleviation in the time of COVID-19. The session starts with the first presentation by Dr. Sanya Nishtar, Special Assistant to Prime Minister in Poverty Alleviation and Social Safety from Pakistan.
Good morning, Excellencies, ladies and gentlemen, and greetings from Pakistan. I would like to begin by thanking the Government of Korea not only for convening this important seminar, but also for their efforts to promote regional collaboration and for highlighting the interlinkages between public health and socio-economic concerns.
Sorry for the inconvenience. There has been a mistake.
Which COVID-19 has so brutally brought to bear.
Sorry.
Good morning, Excellencies, ladies and gentlemen, and greetings from Pakistan. I would like to begin by thanking the Government of Korea not only for convening this important seminar, but also for their efforts to promote regional collaboration and for highlighting the interlinkages between public health and socio-economic concerns, which COVID-19 has so brutally brought to bear. In fact, COVID-19 has reminded us how important health systems are. And while facing the brunt of the pandemic, we have also been reminded that poor health has serious economic consequences on the one hand, whereas on the other, freedom from poverty is a strong determinant of health status achievement. Today, I'm very pleased to share with you that the Government of Pakistan addressed both the health issue as well as the socio-economic fallout of the health issue with equal attention. Our COVID-19 health strategy was multi-pronged. We focused on disease containment and increased our testing capacity from 450 a day to 80,000 a day. We have been able to increase the number of laboratories from 3 to 128 as we moved from a generalized to a localized lockdown. Alongside, we also ramped up our health systems capacity. We added 2,000 ICU beds, we trained over 100,000 health workers, and we developed a system to monitor 800 hospitals in real time. There were SOPs developed for every aspect of the situation and a concerted focus on risk communication throughout the pandemic. And all this was enabled through multi-sectoral national governance and coordination across all levels of the government in Pakistan's federal polity. The combined effect of all these measures was an early decline, in fact, a month earlier than all projections. And I'm humbled to say that our government's efforts are now being recognized internationally. Excellencies, ladies and gentlemen, the lockdowns were a desperate measure for desperate times, and governments in many countries of our region were faced with tough choices throughout. We knew that shutting down the economy meant decimating our livelihoods, and opening it facilitated virus spread. Here in my own country, Pakistan, which is the 5th largest country in the world, there are 24 million breadwinners who rely on daily wages or are self-employed in the informal economy. And life for them virtually came to a standstill with implementation of the lockdown in March. In fact, there were beginnings of civil unrest and rioting caused by widespread loss of livelihoods after about 2 weeks. So to respond to this challenge, the government of Pakistan created the 한-SAARC Emergency Cash Program, which is the largest social protection program ever in the history of the country. This program was rolled out within 10 days of the lockdown to deliver one-time emergency cash grants. $1.23 billion were allocated to support more than 16.9 million families which covers around 109 million people given family size, and this is approximately 50% of the country's population. We use digital capabilities established over the past year as part of 한-SAARC, which is Pakistan's new poverty alleviation framework, to deliver 한-SAARC emergency cash. We adopted a hybrid targeting approach, combining emergency assistance for the known vulnerable with demand-based support for the new poor. We sought requests through an SMS short code service, and then we used data analytics for eligibility ascertainment, drawing on unique national identification numbers and using survey data and wealth proxies. And then payments were biometrically verified. The system that we developed was end-to-end data-driven, it was fully automated, it was rule-based, it was transparent, and it was totally politically neutral. Prior to the delivery of this emergency cash relief, I traveled to several parts of the country and saw unspeakable suffering firsthand. I met daily wage laborers without work for weeks, their families on the verge of starvation, hawkers forced out of work due to the lockdown. I saw staff from otherwise busy hotels and restaurants now sitting at home not knowing how to pay house rent and bills. I met domestic servants, gardeners, security guards, drivers, industrial daily wages laid off by their employers. I met fishermen and miners not knowing what to do with their work settings suddenly coming to a halt. I met transport contractors, bus drivers, hawkers in bus stations, all of them who were out of a job. There were beauticians and barbers who would otherwise make a decent living with suddenly no customers. There were millions of shopkeepers in our cash disbursement points who had been on the verge of hunger with their savings consumed and who were living behind the shutters of their closed shops. There were teachers in private schools with severance letters. There were electricians, welders, painters, carpenters, plumbers, car mechanics, construction labor not knowing where the next meal was coming from. I met taxi drivers who had not had passengers for weeks on end. And the story was repeated across industries and geographies, with even those used to earning a decent living suddenly wondering if their balance sheets would ever square again. The rupees 12,000 or the $75 that we were giving to these families brought stability, and it brought much comfort to millions of families. The whole nation watched as millions of tragedies were averted. And for me personally, it was the most humbling experience of my entire career to be leading 한-SAARC emergency cash to distribute money to half the people of my country at a time of extreme uncertainty. But beyond the immediate crisis, the success of 한-SAARC emergency cash offers Pakistan and other middle and low-income countries invaluable experience in delivering a massive national program in a context of complexity and uncertainty with speed. So in order to share this knowledge, this week we released a report detailing know-how gained in the program's design and implementation, as well as the operational challenges encountered and the means of their mitigation. In a nutshell, our experience has showed us that by combining phones, internet connectivity, and national identity card numbers, a digital, demand-based social protection system can be created to enable those in distress to seek social support during crises. It demonstrated to us how cash transfer programs can be deployed to counter the socioeconomic fallout due to external shocks, such as COVID-19, which presents a long-term challenge. For Pakistan, this was a watershed moment in terms of government functioning. It made the government more agile, more data-driven. It made us more experimental and ambitious. It helped us with the fast-track adoption of cost-effective digital ways of working and new ways of coordination across multiple stakeholders through a whole-of-government approach. Excellencies, ladies and gentlemen, the legacy of such a program is not simply short-term relief. Built into its design are long-term goals to strengthen safety nets and increase financial inclusion both of which we believe will bring lasting benefits to recipients and to Pakistan as a whole. Alongside this is a commitment to transparency and accountability, which was also the underlying motivation for the publication of the report we have just released, because I believe that in order for democracies to deliver, it is essential for a culture of integrity and openness to be ingrained in government institutions and processes. History shows us that disasters and their tragic consequences can be an opportunity to catalyze large-scale social change. And our experience in Pakistan leads us to believe that it is possible to rise to the occasion. So it may be a bit cliched, but this crisis, the COVID-19 crisis, may well have a silver lining. We need to bring to bear that the cost of COVID-19 is not limited to lives lost and morbidity. The cost of COVID-19 is staggering in terms of hunger, children dropping out of school, and foregone healthcare. And as always, it is the women and children that are disproportionately going to bear the brunt of this tragedy. In fact, COVID-19 is threatening to reverse 3 decades of gains in poverty eradication. The MDG on poverty eradication was achieved 5 years ahead of schedule, but now with the corresponding SDG, we are sadly moving backwards and fast. The scale of the action demanded from the world is unprecedented, and just to put things in perspective, there are 4 billion individuals in this world today without social protection. So it is a moral imperative for the international system to prioritize poverty alleviation and social protection, especially in view of a possible protracted crisis which COVID-19 presents and its long-term consequences for vulnerable groups. This is perhaps the worst moment the world has faced since the end of the Second World War. But in our darkest hour, we now have a one-in-a-generation chance to build a fairer world that ends poverty, inequality, and the climate crisis. I believe with imagination and commitment, we can address rising inequality and advance attainment of SDGs in a post-COVID-19 world. I want to thank the government of Korea once again for playing a catalytic part in a transformation which I believe must happen. I thank you.
Thank you, Dr. Sanya Nishtar. It was our honor for us to hear your valuable experience in combating COVID-19 and poverty. Next presentation will be presented by Mr. Anand Kumar Basnet, Undersecretary of Ministry of Land Management, Cooperatives and Poverty Alleviation by Nepal.
Good afternoon to everyone. Honorable Chair, distinguished guests, all participants and friends. It's my pleasure to present something regarding cooperations for poverty alleviation in the post-COVID era. I have divided my presentation as follows. At the beginning, I would like to talk to you on experience on poverty alleviation in the Nepal pre-COVID era. After then, Nepal and Korea relation with respect to tourism, FDI, and employment. SAARC plan of actions on poverty alleviation. Then I will discuss a bit more about the impact of COVID in Nepal, South Asia, and in Korea. Then I will show you the lesson learned from Korea regarding COVID containment, and then Korea and international development cooperation strategy, followed by the relations between Korea and South Asia. And finally, I will summarize my whole presentation, just giving the areas of cooperation. In this slide, we can see that poverty in Nepal is in decreasing order. Government of Nepal has conducted 3 Nepal Living Standard Survey. If we see the data in 1995-96, the head count ratio was 41.8%, and in 2017, it was 18.7%. I haven't mentioned here the poverty gap ratio and squared poverty gap ratio. If we see those data also show that the poverty in Nepal is in decreasing order. However, if we compare the poverty between urban and rural area, there is much more disparity, much more inequality. If you see the data in 2010-11, in urban area, the poverty head count ratio was 15.5%, whereas in rural area, it was 27.4%. As you know, Nepal is committed to achieve Sustainable Development Goals 2016 to 2030. Based on SDG 1, Nepal has set its own targets and indicators. If you see population below national poverty line, Nepal has set 2015 as base year. In that year, poverty below national poverty line was 21.6%. Nepal wants to achieve 4.9% by 2030. In this slide, you can see several socio-economic indicators that shows the status of Nepal. GDP growth rate was 6.75 in 2019. Human Development Index in 2019 was 0.579. It shows that Nepal is in the position of 148th country out of 189 countries. Here also you can see the several socio-economic indicators. If you see imports and export and its ratio, it is about 1:15. That is quite alarming. Our poverty experts say that there are several reasons for poverty reductions. The main reasons are growth in remittances, rise in farm and non-farm income, increasing working age population, and targeted programs. That claim is supported by this data. If you see in the first row, remittance in terms of GDP, in 2007-8, it was 17.5%. In 2018-19, it was 25%. Contribution of non-agriculture sector in GDP, in 2007-8, it was 64%. In 2018-19, it was 73%. Definitely, we have several targeted programs for poor. Some of the important programs I have highlighted over here. Poverty Alleviation Fund that is supported by World Bank. There is another important program like Micro Enterprise Development for Poverty Alleviation that is supported by UNDP Nepal. We have several social protection programs. We have Prime Minister Employment Program. We have Prime Minister Agriculture Modernization Project, and several projects and programs are implementing with the support of development partners, INGOs and NGOs. Still, we have several challenges to reduce poverty. The first challenge is identifying real poor, to capacitate them and to ease their access to natural resources and other available resources, to run various poverty alleviation programs in a high scale, and to coordinate all the targeted programs to modernize agriculture sector, to develop industry sector and service sector, to use remittance to productive sector, to build resilience capacity against the consequences of natural disaster and climate change. These are taken as the challenges for poverty alleviation in Nepal. Now I would like to show you the relation between Nepal and Korea with respect to tourism, FDI, and employment in terms of some data. As you know, Nepal is a beautiful country. Many people around the world want to come to Nepal for entertainment, to see the natural beauty. If you see the data in 2019, the share of Korea was 3%. Another thing is that we don't have enough employment opportunity in our job market. So many Nepalese people go to foreign country for jobs. If you see the data from 2006 to 2019, the share of Korea was 0.9. It is nearly 1%. Also, many countries around the world want to invest in Nepal. If you see the data till 2019, the share of Korea was 3.8%. With that investment, several employment opportunities are created in Nepal. If you see the data till 2019, the share of Korea was 4.4%. South Asian countries have their own SAARC plan of actions on poverty alleviation. Actually, this plan of action has incorporated several areas and several sectors. Those sectors, those areas are also in line with the Sustainable Development Goal 2016 to 2030. As you see, some of the important areas I have highlighted over here: good governance, development of IT, education sector, self-drinking water and sanitation, investment in human capital, health sector, empower local communities and governments, poverty alleviation programs, targeting poor, expand social safety nets. Further, agriculture and livestock development, employment generation, small and medium enterprise development, rural infrastructure development, tourism sector development, gender equality, preservation of environment, and exchange of good practices. All these areas are taken as internal policies of the plan. There is also external policy in that plan. South Asian countries want to work with the developed countries to increase ODA to 0.7% of GNP, market access, debt relief, grant assistance, preventing corrupt practices in international trade and service transactions, disallowance of illegal capital flows into international banking systems are taken as external policies of the plan. Now, I would like to show you impact of COVID in Nepal. Definitely, Nepal is highly affected due to COVID-19, but we are testing few people. Here you can see in the data, just 1.2% of the population are tested. Among the tested population, infected are 19,273, deaths 49, cured 14,021. Recovery rate is 72.8%. And these numbers are increasing hour by hour, day by day. I don't know, actually we don't know when this will stop. We have problem on contact tracing. We have lack of digital tracking systems. If we see the treatment and rescue side, we have inadequate quarantine and isolations. We have inadequate other health facilities and services. If we see the economic growth and employment sector, economic growth has been contracted, remittance has been contracted. Many migrant returnees are entering into the local market. Actually, we are sharing our unemployment. From different sectors like construction, tourism and accommodation, trade and commerce, transport and storage, and from education, around 3.5 million jobs are hard hit. These are all from the formal employment. We have actually 60% of total job are from informal sector. So informal sector are also highly affected. Government revenue has been also contracted. Here I want to show you the growth impact of COVID in South Asia. If we compare to last 40 years, the scenario, what we are getting in 2020 is the worst scenario. The GDP growth is expected between 1.8% to 2.8% in 2020. So in this situation, all these sectors has been dried off, like garments, supply chain, consumer, investor sentiments, tourism, international capital flows, remittances, all have been contracted and dried off. The graph shown below also shows the same thing. Now I would like to show you social impact of COVID in South Asia. First, let's see the employment sector. 21 million jobs are already lost in the first quarter of 2020. Similarly, 110 million jobs are already lost in second quarter of 2020. These are all from the formal sector. The formal job in South Asia is just 20% of total employment. Above 500 million people would be pushed into poverty by COVID and lockdown, and children are much more vulnerable. Let's see in the health sector. The economically poor people don't have access to the health facilities and services. There is not easy access for them, and it's also difficult for them to maintain social distancing, and they are facing lack of basic food. Let's see education sector. 430 million children in South Asia are relying on remote learning. 32 million children already out of school. So this data show that the severe violence could rise further in South Asia. Here we can see the impact of COVID to Korea in terms of GDP growth. Graph shows that all the OECD countries, if we analyze this graph in terms of 2020 projected change in GDP, Korea is the least hit country. In Korea, the projected change in GDP in 2020 is expected between -1.2% to -2.5%. Now, what we learned from Korea, let's see here. Actually, they don't have lockdown, but they tested their population massively. They are highly technology based. They use contact tracing, smartphone, electronic bracelet, and other smart city database. They compile all the data from different sources. They upgraded their hospitals, health facilities, and services. They have strict preventive protocols. They rationalize their public expenditure. Actually, they revised their budget several times. They are quite transparent to disseminate their information regarding COVID. Now let's see Korea and international cooperation. Actually, Korea is the 4th largest economy in Asia. It is 15th largest donor country. It has strategic priorities for 2016 to 2020. Actually emphasizing economic infrastructure, environment policy, sustainable development goal alignment, health, education, and agriculture development. They have post-2020 priorities. Here, they are focusing on transport, information technology, health, water sanitation, and hygiene. They are still focusing on grant rather than loan. Infrastructure is South Korea's biggest area of bilateral cooperation. This graph shows that the position of Korea in terms of donor countries. Korea has New Deal as a recovery strategy. They have planned to spend a fund of Canadian dollar 85 billion by 2025. They have planned to provide financial support to key industries disrupted by pandemic. They have planned to focus to expand digital infrastructure and services. They have planned to establish a Smart Korea Fund for digital sector. They have training plan for artificial intelligence and software talents. They have planned to install high-speed internet in rural villages. They have planned to provide digital infrastructure for all public schools. It means they are trying to build digital world. They have proposal to increase ODA. Good news is Asia remains the top priority region. They have COVID-19 response ODA strategy. They want to increase health ODA, humanitarian assistance. They have planned for tailoring South Korea's experiences. Actually, they have already appointed 2 professors as ambassadors for this purpose. They have planned to secure fast-track ODA budgets for any emergency and urgent needs. Now let's see Korea and South Asia relations. Actually, Korea is the observer of SAARC since 14th SAARC summit. Korea has proposal to engage with SAARC for mutually beneficial cooperation. Korea has conducted several partnership seminars to disseminate information and to generate ideas. They are assisting to South Asia in terms of ODA, technical support, higher education for government employees. They have employment permit system. If we see the data, significant number from South Asia. So this is my last slide. I would like to summarize my whole presentation here. There are several areas of cooperation. I have highlighted some of these here. Just say health facilities, technology and knowledge transfer, humanitarian support, employment support. These areas could be short-term and long-term purpose for the areas of cooperation. And in my previous slide, I have discussed that the areas considered in poverty plan of action for South Asia, there are several areas are incorporated. Similarly, in Sustainable Development Goals, there are also many areas are incorporated. We can think on those areas and we can generate the cooperation between Korea and SAARC. We know poverty at one corner may affect other corner of the world. So I would like to urge the policymakers to think more on this regard. I think there are 2 ways for poverty reduction. The first one is we have to develop our economy strong. And the second one is we have to have positive discrimination for poor. Our policies have to guide in this connection. We have to identify poor, implement targeted program for them, ensure their participation in those programs, provide employment for them, capacitate them. Is there access to resources? Is there access to basic needs? And remove all barriers and discriminations for them. This could be the strategy for poverty alleviation. So we need to think in this connection. I would like to end my presentation here. Thank you for your patience.
Next presentation will be presented by Mr. Karma Funsho, Chief of Department of Regional Cooperation of Ministry of Foreign Affairs from Bhutan.
Mr. Chairman, fellow panel members, distinguished guests, ladies and gentlemen, Kuzuzongpo, and a very good afternoon. Let me begin by thanking the Republic of Korea for organizing this very important webinar seminar during these trying times. It will go a long way in further enhancing the close cooperation between Republic of Korea and the SAARC. The theme for the seminar is most appropriate and provides an opportunity for SAARC member states to share the experience of their fight against the pandemic and benefit from the Republic of Korea's experience. With cases soaring in the region as well as globally, the Republic of Korea has shown that the situation can be contained through swift and strong measures. Mr. Chairman, starting as a health emergency, the COVID-19 pandemic has evolved into an economic and a human crisis of unprecedented proportion, as governments locked down in an effort to contain the pandemic. Economic activities have been disrupted, leaving millions of people jobless, pushing them into poverty and hunger, and causing a downturn in the world economy. South Asia, with a quarter of the world's population and accounting for the largest share of the world's poor, has been adversely impacted severely. Millions of workers have lost their jobs, inequalities have widened, and gains made in poverty reduction and sustainable development goals reversed. Cooperation in South Asia, both bilaterally as well as within the framework of SAARC, would supplement the national action in addressing the challenges posed by the pandemic. In this regard, the Royal Government of Bhutan would like to thank the Government of India for taking the initiative to organize the virtual meeting of the SAARC leaders held on 15 March 2020. Following the meeting, a number of activities, including a USD 22 million COVID-19 emergency fund, sharing of disease surveillance software, creating common research platform to coordinate research on controlling epidemic diseases within the region, and telemedicines, among others, were initiated. Other virtual meetings followed, including the SAARC Trade Officials meeting on 8 April and SAARC Health Ministers meeting on 22nd April. The meetings have contributed to enhanced cooperation among SAARC members to turn the crisis into an opportunity to create more equal, sustainable, and resilient societies in South Asia. Greater regional cooperation among South Asian countries is critical, not only to manage the COVID-19 crisis, but also to recover from the crisis in a sustainable manner. Mr. Chairman, allow me to share Bhutan's experience in fighting the pandemic and the challenges we are facing. Bhutan is particularly vulnerable to COVID-19 due to our limited health infrastructure, shortage of doctors and specialists, and laboratory experts. While sparsely populated, around 1/5 of the population live in its 3 most populated urban area, including the capital Thimphu. Given this reality, an effective and resourceful response was all the more vital. As of 29 July 2020, there were 99 confirmed cases, of which 86 have recovered and 13 are undergoing treatment, and no fatalities. All are imported cases of Bhutanese returning from abroad, including 2 foreign tourists. Bhutan has been preparing since January 2020 with the identification of health facilities and teams in case of an outbreak. The Ministry of Foreign Affairs sent out its first advisory to the Bhutanese to refrain from traveling to the affected areas on 25th January. By then, the Ministry of Health had already initiated their response plans and started advocating infection and control measures to the general public. Beginning February, hospitals identified for COVID-19 patients were equipped with facilities required to diagnose and manage cases, including ICU services. A dedicated set of healthcare staff were identified from across the country, and airlifting of patients to centers requiring intensive care were planned. The Royal Center for Disease Control was identified as the main lab for conducting all tests related to COVID-19, and health staff were designated with well-established protocol as per the interim guidelines on sample collection, storage, packaging, and shipment of samples. The Royal Center for Disease Control, as per the standard protocol and WHO recommended procedure, were fully equipped for conducting real-time PCR. Trainings were provided to the medical professionals of all districts across the country to further strengthen preparedness and response. With the detection of the first case on the evening of 5th March 2020, the government immediately started contact tracing of the index case. Based on travel itinerary and history of the first patient, all individuals who came in contact with the patients were identified the same night and quarantined. The close contacts were quarantined in the designated hospitals, while the rest were home quarantined with strict vigilance. With such timely action, community spread of the disease was avoided. Semi-lockdown measures were imposed early on, with schools and entertainment sports being shut down first, and people being urged to maintain physical distancing. Bhutan closed her doors to tourists immediately after the index case. Health is a priority sector in Bhutan, and all citizens receive free health care. The mandatory 21-day quarantine for all Bhutanese returning from abroad played a vital role in ensuring there is zero community transmission. In addition to free testing and medical services, all meals and accommodations are provided freely by the state in the designated quarantine and isolation facilities. The Ministry of Health posts daily updates on its website and social media accounts. It holds weekly press conferences, which includes a sign translator, and has created a social media group for journalists where officials respond immediately to any query or concern raised. The government started an advocacy campaign among all media platforms at its disposal to educate the Bhutanese masses on COVID-19 safety measures. Bhutan Telecom, the state-owned telecom service provider, assigned a caller ringback tune, a song encouraging people to stay home, to all its subscribers. Authorities have built makeshift 24-hour flu clinic in all the districts. Anyone with flu-like symptoms are advised to visit the clinics and not the hospitals. A national mental health task force has been instituted with a 24/7 helpline. Psychological first aid training has been provided to many frontline workers as well as interested citizens. The government set up a registry for the vulnerable population, the elderly people with chronic conditions, pregnant women and children, and provided free care packages including multivitamins to more than 51,000 people above the age of 50 and continues to do so at regular intervals. Bhutan acted with speed and decisiveness to put in place measures to prevent the spread of the virus and formulate socio-economic response and recovery program. As a result, we have so far been successful in managing the situation, preventing community transmission and mitigating the impacts on the livelihood of the people. But we have deep concerns for the future. The impacts on livelihood and the economy have been severe and will further deepen, especially if the pandemic situation worsens. If community transmission takes place, our weak health infrastructure will be severely tested and will likely not be able to cope. Even under the present situation, things like procuring essential medical supplies for the pandemic is a big challenge due to lockdowns and export restrictions. Mr. Chairman, while South Asia has achieved overall development and economic growth in recent decades, nearly a third still lives on less than $1.50 a day. Eradicating hunger and food poverty remains an important objective for our region, given that this extreme form of human deprivation is deeply inimical to the notion of human happiness and well-being. In Bhutan, the developmental planning framework is inspired by the philosophy of gross national happiness, which acknowledges the importance of sustainable economic development, particularly to bring people above the poverty level, and then emphasize that material and physical well-being must be harmonized with environmental, cultural, spiritual, and emotional well-being. In addition to local and national policies and initiatives of the government to elevate poverty, His Majesty the King travels length and breadth of the country to ensure that people in the most remote areas have adequate land to sustain themselves, health facilities, educational opportunities, access to spiritual institutions and teachings, and especially the will and the spirit to improve their living standard and the well-being of their families. Bhutan has successfully aligned the Millennium Development Goals and Sustainable Development Goals and the SAARC objectives with national priorities and integrated them into the National Development Planning Framework. Over the past 3 decades, Economic growth averaged 7.5%. Poverty has reduced significantly to around 8% in 2017. Trade volumes and compositions have increased and improved. Life expectancy has improved to over 70 years and literacy rate is over 71%. Bhutan remains on track towards achieving most of the SDGs with varied progress on the multitude of goals and targets. Despite the progress, Bhutan is still confronted with challenges of eradicating poverty in all its forms, and one of the parameters for reducing inequalities and eradicating poverty pursued by the government is improved health services through provision of quality and comprehensive healthcare services. Now with the disease, the challenges of eradicating poverty has become even more daunting. For a landlocked country that relies heavily on imports, closing border and transport and other restrictions are taking a heavy toll. Challenges are increasing by the day. Bhutan faces increasing issues of unemployment, economic instability, and increased stress on the health system. It has slowed down the pace of development and disrupted normal life like anywhere else in the world. In view of the health and socio-economic difficulties brought on by the COVID-19, His Majesty the King instituted a relief fund that will deposit money every month in the bank account of 23,000 affected individuals. The tourism and the hospitality sector, the country's biggest revenue generators besides hydropower, has been the hardest hit. At least 50,000 Bhutanese are estimated to be engaged with tourism and hospitality. Therefore, the Tourism Council of Bhutan, through its tourism stimulus package, is providing employment opportunities for those employed in the sector in waste management, infrastructure, product development, and service, among other fields. They are also being encouraged to farm on government land. Financial institutions deferred loan repayments and waived off interest, initially for 3 months, beginning April, and then extended it until March 31st, 2021, to ease economic pressure on businesses and individuals. The cost for the waiver for the first quarter will be borne by the financial institutes and the government at the rate of 50-50. At least 5,000 Bhutanese living across the border in the town of Jaigaon, in the East Indian state of West Bengal, were brought into Bhutan before it fully closed its border and are now provided free shelter by the government. Solidarity and actions were seen from all sections of the society, and every Bhutanese played their part. The generous support we have received from international players, partners, which as of June 2020 was USD 42 million. In addition to in-kind assistance, medicines, test kits, PPEs and other medical consumables from both bilateral and multilateral donors have been most helpful. Mr. Chairman, Bhutan appreciates the strong initiatives taken by countries in the region to fight the pandemic and is aware that each country continues to face challenges in dealing with the situation. The SAARC member states, along with observer countries, should engage in more regular virtual meetings to share and learn from each other, especially in areas of sharing best practices both in health and socio-economic disciplines. Such meetings will help discuss and resolve issues during the crisis and help each other recover from economic difficulties and losses. Despite facing numerous natural and man-made disasters, South Asia has indeed come a long way in improving the lives of its citizens, and we are confident that given the dynamism and resilience of our economies, South Asia will overcome the challenges posed by COVID-19 pandemic and emerge out of this health disaster more united and stronger. The COVID-19 should be used as an opportunity to revive the SAARC process, to harness the full potential of our regional cooperation. During such unprecedented challenges faced by the region and the world, SAARC needs to align itself to the emerging priorities. There is always a risk of institutional redundancy if we do not innovate and move forward to make SAARC an effective and well-integrated regional group. Bhutan, on our part, stands fully committed to make SAARC a dynamic and effective regional organization that contributes to increasing the prosperity and happiness of our peoples. Mr. Chairman, in conclusion, I would like to take this opportunity to express our gratitude to the people and government of Korea for the support and assistance extended to Bhutan during this pandemic. The budgetary support and the oxygen D-type cylinders donated by the Bhutan International Cooperation Agency, Bhutan World Friends Program Office in Thimphu, to the government of Bhutan greatly contributed to the royal government's effort to contain the spread of COVID-19 virus. The Republic of Korea is a valued developmental partner with whom there is a tremendous potential for greater bilateral cooperation. I would like to once again thank the Republic of Korea for organizing this important virtual seminar. Thank you and Dashidele.
Last but not least, we continue to have the last presentation of this session by Mr. Dadhi Ram Bandari, Director of Information and Poverty Alleviation from South Asia Association for Regional Cooperation.
Distinguished Professor Choi, Chair of the Session, Excellencies, fellow panelists, participants, followers of the YouTube channel live streaming, ladies and gentlemen. I am pleased to represent the Secretariat of the South Asian Association for Regional Cooperation at the 11th Republic of Korea-SAARC Partnership Online Seminar, organized on the themes of COVID-19 pandemic and poverty alleviation. At the outset, I wish to convey greetings from His Excellency Mr. Eshala Ruan Birakun, Secretary General of SAARC, to the distinguished chair, panelists, and participants of this seminar. We are greatly inspired by the remarks of the Secretary General of SAARC and the distinguished Director General of the Ministry of Foreign Affairs of the Republic of Korea during the opening session earlier today. Before I speak about cooperation on poverty alleviation, I wish to express my sincere gratitude to the Ministry of Foreign Affairs of the Republic of Korea for inviting me to attend this seminar and share my observation. I deeply appreciate the Institute of Indian Studies of the Hankook University of Foreign Studies, Seoul, for being part of the seminar. In fact, the annual Republic of Korea-SAARC Partnership Seminar has now become an annual flagship event to assess the current status of our relation and explore new avenues of cooperation for mutual benefit. As the Secretary General of SAARC mentioned in his congratulatory remarks, SAARC and the Republic of Korea have a strong relationship ever since it became an observer to SAARC in 2006. Since 2008, the Republic of Korea has been organizing regular training programs on the development issues for the officials of the member state of SAARC. Such programs are focused mainly on SAARC's priority areas such as agriculture, infrastructure, public health, information and communication technologies, renewable energy, environment, and several others. This seminar on COVID-19 and poverty alleviation is yet another manifestation of the Republic of Korea's willingness to further deepen its collaboration with SAARC. Distinguished participants, we are passing through an unprecedented time in history, triggered by the global pandemic. A recent working paper by the United Nations University mentions that global poverty could increase for the first time since 1990, representing a reversal of approximately a decade in the world's progress in poverty reduction. The estimated number of people living in poverty could increase from 420 to 580 million due to the possible contraction in global GDP. Moreover, it will pose several serious challenges in achieving the Sustainable Development Goals, especially the target of ending poverty by 2030. Home to nearly a quarter of the world population, South Asia cannot be removed from the after effects of this global pandemic, given the level of development and concentration of poverty in the region. Moreover, the region's fight against poverty alleviation will be severely impacted by the slowing down of the global economy, including factors like changes in trade and production factors, disruption in supply chains, consumption shocks, and output contraction, among others. It is in this backdrop that the convening of this seminar is very timely. Distinguished participants, in the past several decades, South Asia made impressive progress in poverty reduction, which had directly contributed to the achievement of Millennium Development Goals. South Asia's performance on 2030 Development Agenda will also contribute to the attainment of Sustainable Development Goals. The progress achieved in reducing extreme poverty in South Asia was mainly due to the combined impacts of high rate of economic growth, reduction in population growth rate, increased investment in human capital, especially on health, education, drinking water, sanitation, and basic infrastructures, improvement in service delivery mechanisms, as well as fiscal reforms. However, for a sustained reduction in poverty alleviation, we need inclusive growth, greater employment opportunity, and income entitlement, among others. Poverty alleviation is the overarching goal of SAARC in the attainment of its charter objective of promoting the welfare of the people of South Asia and improving their quality of life. SAARC has several important mechanisms and a plan of action on poverty alleviation. SAARC poverty alleviation ministers meet periodically to review the policies and program and to provide policy direction and overall guidance in alleviating poverty. Similarly, senior officials and experts from the member state of SAARC also meet regularly to take forward the objective of reducing poverty in the region. Recognizing that the problem of poverty in South Asia needs to be tackled from a multidimensional aspect, the SAARC Plan of Action on Poverty Alleviation was adopted in 2004. We are now in the process of updating the Plan of Action in line with the 2030 Development Agenda. We are also working on the contextualization of the Sustainable Development Goal in the regional perspective. Distinguished participants, as we all know, poverty is a cross-cutting issue. Several other SAARC mechanisms, bodies, and agreement also complement to the regional effort on poverty reduction. Given the importance of agriculture for the region, the SAARC agriculture ministers unanimously adopted the Thimphu Statement on Agriculture and Rural Development in June 2019, with 19 points regional pledges and strategies to deal with emerging challenges being faced by the region in agriculture and allied sectors. The same meeting also agreed to promote multi-sectoral approach to attain high level of food safety and nutrition security, promote climate resilient agricultural strategies and technologies, facilitate general mainstreaming and attracting youth and women in agriculture, among others. These pledges and decisions, once implemented, could complement regional efforts towards poverty reduction. Similarly, the third meeting of SAARC Ministers of Education in October 2019 reiterated the important role of education and enhanced regional cooperation for eliminating poverty and to face development challenges in the region. The meeting adopted the Education 2030 SAARC Framework for Action, which provides an overall strategy for educational development in the region and seeks to promote specific commitments of South Asian government in achieving SDG 4 targets. The umbrella funding mechanism of SAARC, namely the SAARC Development Fund, is implementing 12 different projects to contribute to the goal of poverty eradication in the region by improving the livelihood of small farmers, women, and children, among others. The SAARC Development Fund has also proposed an allocation of $5 million for funding COVID-19 projects in the region. Distinguished participants, as I spoke earlier, the ongoing pandemic will have adverse impact on poverty eradication effects. of the South Asian region. Since the outbreak of the pandemic, a number of important initiatives has already been taken by SAARC to mitigate its adverse impact on the region. In March, the SAARC leaders held a video conference and created a SAARC COVID-19 emergency fund with voluntary contribution from the member states. As a follow-up to the SAARC leaders video conference, the SAARC Health Ministers video conference was held on 23rd April 2020. At the expert level, senior trade and health officials from the SAARC country have also met to discuss measures to fight the global pandemic. The interim unit of SAARC Disaster Management Center has been providing daily COVID-19 updates from South Asian countries. Distinguished participants, the impressive development achieved by the Republic of Korea in the past several decades can be a useful learning experience for the countries of South Asia. Lessons learned and success stories of the Republic of Korea on poverty alleviation can be replicated in the member states of SAARC through knowledge sharing, cross-fertilization of ideas, and organizing regular training, capacity building programs, and exposure visits of the experts of SAARC to Korea. Before I conclude, let me reiterate our sincere appreciation to the government of the Republic of Korea for providing learning opportunity to our officials since 2008. We look forward to further learning opportunity from the Republic of Korea for the officials of the member state of SAARC in our priority areas such as communication, connectivity, agriculture, public health, energy, environment, and economic cooperation. I thank you.
Now we proceed to the open discussion. Please give a big round of applause to the presenters. And please come to the stage when the name is called. Professor Lee Sun-chul from Busan University of Foreign Studies, and Mr. Yudap Newpain, First Secretary of Embassy of Nepal, Ms. Lim So-yeon, Director General of Southwest Asia and Pacific Department of Korean International Cooperation Agency, and Professor Kim Mi-soo from Hankuk University of Foreign Studies. We were supposed to have Her Excellency Mumtaz Zahra Baloch, a Pakistan ambassador to the Republic of Korea, but due to her schedule, she left this seminar early. She sent a sincere apology for us. Please give a big round of applause to the panelists and chair.
안녕하십니까. 저는 한국말로 진행하도록 하겠습니다. 저희들이 지금 먼저 저는 부산 외대에서 온 이순철입니다. 그리고 먼저 여기 오신 분들을 소개를 먼저 해드리겠습니다. 원래는 파키스탄 대사님께서 계시는데 좀 전에 일정 때문에 자리를 같이 못 하게 됐습니다. 대신에 저희 주한 네팔 대사관의 미스터 우다브 누판 펄스 세크레터리 같이 하셨고요. 그 다음에 코이카의 주한 서남아 태평양실의 임소연 실장님 오셨습니다. 그리고 한국외대 인도연구소의 김미수 교수님 오셨습니다. 여기에 참석해 주신 여러분들께 감사드리겠습니다. 저희들이 지금 큰 문제라기보다 먼저 진행에 대해서 말씀을 드리도록 하겠습니다. 저희들이 이게 6시 원래는 20분까지 마치기로 돼 있는데 저희들은 시간을 이미 거의 초과를 했습니다. 그래서 저희들이 가능하면 6시 반까지 마치도록 하겠습니다. 제가 여기 오기 전에 밖에 비가 많이 왔어요. 그래서 여러분들 여기 하루 종일 있어서 비가 온지도 모르고 계셨을 텐데 비 걱정도 좀 해야 되고요. 그리고 저녁도 무슨 식사도 하고 가셔야 되겠죠. 그래서 저희들이 가능하다면 여러분들께서 5 minutes, can you do that? 5 minutes. 각 그 토론자들한테 5분 정도씩 시간을 드리려고 하고 있습니다. 그래서 5분 동안에 물론 이 많은 얘기들을 5분 동안에 할 수 있을 거라고는 생각하지 않습니다. 그렇지만 여러분들이 최대한 효율적으로 시간을 아껴서 해주시고 여러분들에게 꼭 해주실 말씀만 해주시면 감사드리겠습니다. 저희들이 사실상 이게 빈곤 구제 문제라는 게 굉장히 심각한 문제이기도 하고 그리고 저와 이게 경제학적으로 이제 최근에 코비드 영향을 분석을 해봤는데 이게 며칠 만에 끝날 일이 아니고 이제 제대로 정상적으로 옛날까지 똑같이 되돌아올 수 없지만 비슷하게라도 되돌아오면 3, 4년은 걸릴 겁니다. 그렇기 때문에 장기적으로는 이게 가장 큰 문제입니다. 그래서 이미 여기에 그 스피커들이 많은 말씀을 해주셨는데 저희들한테 그에 대해서 그와 스피커분들이 말씀해 주신 거나 아니면 여러분들이 뭐 그 이외에도 꼭 하신 말씀 중심으로 해주셨으면 감사하겠습니다. 먼저 우리 그 유다부 미타미사분 대표한 퍼스트 세크레터리 먼저 부탁드리겠습니다.
Thank you. Good afternoon. 안녕하세요. First, I would like to thank the organizer, the Asian and Pacific Affairs Bureau of the Ministry of Foreign Affairs of the Republic of Korea for hosting the Korea-SAARC Partnership Seminar annually since 2010. I am grateful to attend this 11th series of the seminar representing from the Embassy of Nepal in Seoul. As has been much discussed already and previously, I believe this is a forum to find ways for more meaningful engagement between the ROK and the SAARC member states. So far as cooperation and poverty alleviation is concerned, it carries the entire theme of both the SAARC as a region and its much pronounced partnership with the Republic of Korea. As a regional initiative for advancement, the South Asian Association for Regional Cooperation, SAARC, is plodding for the last 35 years through aspirations and struggles. Several efforts have been made at policy, institution, mechanism levels in order to drive the region more vibrantly, which has been elaborated intensively and comprehensively by so many presenters and discussants already. From macro measures of trade liberalization with SAFTA, South Asian Preferential Trading Agreement, and SAFTA, the South Asian Free Trade Area, put in place for economic connectivity, schemes such as Bhutan, Bangladesh, India, and Nepal, the sub-regional connectivity by means of transport. There have been educational initiatives at South Asian University, SAU, which is in New Delhi, India, and financing efforts with SAARC Development Fund, SDF. At national level, policies around human development by a massive investment in health and education sectors, credit facilities and grant targeted to the indigent have been brought in place. Still, the SAARC as a region stands for poverty, with nearly 1/3 of the global poor still there. The poverty alleviation in the SAARC region sincerely demands each member state to be harmonious enough to grow together. 3 out of 8 are the landlocked countries, namely Nepal, Bhutan, and Afghanistan. Systemic transit rights of LLDCs are equally momentous in the region. In order to anticipate higher from the partnership between SAARC and the ROK, therefore, efforts must be made toward ensuring integration both intra-regionally and externally. This seminar effort is external connectivity. So internal connectivity is also equally challenging and needed. If analyzed from the Human Development Index HDI perspective, the health, education, and income parameters, the income factor appears most vulnerable in SAARC. Technological lag and low productivity, fragility of the remittance income. Nepal's alone remittance contributes 25% of the GDP, as already presented by Nepal presenter. Fragility of the remittance income and lack of ample investable fund towards self-sustained growth simply illuminate the situation. However, amid the ongoing crisis of the novel coronavirus, the health factor vulnerability cannot be underrated. In the SAARC region alone, around 2.5 million cases already confirmed. Over 1,000 people are dying of COVID per day, while thousands of people are catching the virus every day. If analyzed from a broader perspective, in the framework of governance, that is politics, social aspect, society and environment, the nature, much is to be done in terms of governance. If analyzed from resource perspective, SAARC as a region possesses 23.9% of the world population, with 66% of it being active, 1564 age group, World Bank 2019 data, vast natural resources including the Himalaya and large water resources. By observation, as I see, the region lacks infrastructure for required mobility and technology for productivity, and both of these qualifiers for productive connectivity. In this context, having a partnership with the Republic of Korea is a pleasure source for SAARC as a region. The advancement of the ROK in all spheres of modernity and the SAARC aspiration to grow must find some conjunction and connectivity. For poverty alleviation, such conjunction needs to orient towards the gaps analyzed above, social mobilization towards mass employment at local level, because the SAARC region's large base of income relied on remittances is very much fragile, as I see. That is required mass mobilization, social mobilization for mass employment at local level for sustained income source, technical and technological cooperation on which the ROK has global expertise, very much renowned, primarily focused on both physical and digital infrastructure that we need, that we lack, can be of immense significance. Projects and programs of foundational benefits such as skill and entrepreneurship development could be instrumental in this regard. Respective national governments and other sources of funds. The simple ROK support fund may not be enough for partnership programs that we anticipate. So what I feel is respective national governments and other sources of funds may be linked, may be necessary to be linked to assure required finances for the implementation of the partnership projects and programs. Many other development cooperation flowing from ROK to SAARC member states also need to be consolidated toward the same agenda of poverty alleviation in the region, because SAARC by theme, as I understand as a SAARC member state citizen, that SAARC is to alleviate poverty, fighting against socioeconomic vulnerabilities together and uplifting our status at the global par. So it needs to be consolidated. The ROK's all supports need to be consolidated toward the same agenda of poverty alleviation in the region. Alignment of such ODAs can contribute more. Ultimately, the partnership gets meaning once the region stands up and moves out of rampant poverty. The ROK, though it still faces some scale of COVID, has a proven capacity to tackle the crisis, and much has been already presented by presenters from Korea and even from Nepal. He has detailed in his presentation about how Korea is doing best in tackling the crisis of COVID. In this context, again, having a partnership with the Republic of Korea is a pleasure source for SAARC, because at this time, SAARC as a region needs the support related to the tackling of COVID, as well as the subsequent and concurrent related humanitarian support is outstanding there. So let us make the ROK-SAARC partnership meaningful by all reasonable means. As of 2 August, until yesterday, I would like to give you a short update on Nepal. The PCR has been done only lately. Actually, Nepal has adopted the PCR test. Earlier, most of the countries, like most others, we did RDT, and based on which fallacious conclusions were drawn. So we had to rely on PCR, though late. Now we rely fully on PCR, and near 400,000, 391,270 PCR tests have been done, and the confirmed cases are 20,332. This is based on PCR test, and recovered already 14,603, and death number until yesterday is 57, which stands for 0.28%. So based on this of the confirmed cases, so based on this, the fatality rate of Nepal is low. But still much is to be done, because we are vulnerable. We are between India and China. China, where the outbreak happened by the end of December last year, and India, where so big number is happening every next day. So, and there is open border, although it has been closed for sealed for now, but porous borders are there, and large population with large infections is a big challenge. That's why we need to be more cooperative, and sharing this information about Nepal and saying this much, I thank all of you for your patience. Thank you.
네, 감사합니다. 저희들한테 굉장히 많은 얘기를 해주셨습니다. 적극적으로 저희들이 협력하고 참여해서 지역 내 협력, 지역 내라든가 지역 외 협력까지 하자. 그리고 저희들이 그 인프라라다 뭐 전반적인 얘기를 다 해주셨습니다. 그리고 이제 한국의 경험이라든가 이런 것들 같이 협력할 수 있는 방안들을 같이 모색해보자 이런 말씀인 것 같습니다. 굉장히 감사드리겠습니다. 다음으로 코이카의 임소연 실장님 말씀을 전해주시죠.
네, 저희가 통역 시스템이 있어서 한국어로 하겠습니다. 일단 워낙 코로나의 영향에 대해서, 광범위한 영향에 대해서는 많은 발표자분들이 말씀 주셨기 때문에 저는 한국정부 개발협력기관으로서 코이카가 하고 있는 활동 간단하게 말씀드리고, 그리고 저희가 그 빈곤 완화를 위해서 빈곤이 없어지는데 개발협력을 진행하는 데 있어서 저희 중점을 두고 있는 부분에 대해서 간단하게 말씀드리겠습니다. 일단 코로나 발생 이후 코이카는 바로 대응하는 프레임워크를 만들었습니다. 그래서 Building Resilience Against COVID-19 Through Development Cooperation이라고 프로그램을 만들었고, 한국 정부의 방침과 개발협력 전략과 이 프레임워크에 따라서 긴급 구호부터 그 중장기적인 코로나 대응까지 지원을 하고 있습니다. 그래서 코로나의 광범위한 영향이 단순히 보건의료에만 국한되지 않기 때문에 보건 부분에서의 진단키트 지원, 그리고 보호구 지원, 이런 부분부터 시작을, 그리고 또 한국의 그 방역 경험을 공유하는 것부터 시작을 해서 그 가장 코로나로 인해 영향을 받고 있는 그 취약계층에 대해서 긴급 식량 지원들이라던가 농업 부문 지원하는 그런 이제 긴급 지원까지 함께 지원을 하고 있습니다. 그래서 그 코로나가 단순히 그 단기간으로 끝날 것이 아니라 장기간에 이어질 것을 대비해서 저희가 이런 단기간의 긴급구호 활동뿐만이 아니라 중장기적인 지원도 계획을 하고 있고, 이 중장기적인 지원에 있어서도 특별히 다른 부분보다도 이 poverty alleviation이라던가 그 resilience의 강화, 그래서 앞으로 또 발생할 수 있는 이러한 그 위험에 저희가 대응할 수 있는 개도국의 역량을 강화하는 데 굉장히 노력을 하고 있습니다. 특별히 저희가 코로나에 대응하는 데 있어서 저희가 중점적으로 고려하고 있는 부분은 첫 번째로는 취약계층에 대한 지원입니다. 많은 발표자분들께서 말씀해 주신 것처럼 코로나로 인해 가장 피해를 받고 있는 분들이 이제 빈곤층이고, 그 중에서도 또 여성과 청년, 그리고 또 난민, 이런 분들이 가장 코로나의 영향을 크게 받고 있습니다. 그 ILO가 리포트한 바에 따르면은 특히 이제 미숙련 노동자들, 그리고 또 그 인포멀 섹터에서 지금 활동을 하고 있는 그 비공식 노동자들이 가장 코로나의 영향을 크게 받았고, 이분들은 단순히 그 일자리를 잃었을 뿐만 아니라 또 앞으로 교육이라던가 이런 부분에서의 어려움을 받고 있기 때문에 당장의 어려움도 있지만 또 앞으로도 어려움이 예상되고 있는 상황입니다. 따라서 저희가 코로나에 대한 대응을 함에 있어서는 특별히 이런 취약계층에 대해서 굉장히 많은 관심을 기울여야 한다고 생각합니다. 그리고 마찬가지 같은 맥락에서 그 마이그런트 워커즈라던가 아니면 저희가 농민들에 대한 지원도 특별히 많이 고려를 해야 될 것 같습니다. 일단 그 통행에 제한이 걸리고 물류 이동에 어려움이 있었기 때문에 이분들이 그 일자리에 접근을 한다던가 아니면 시장에 접근을 하는데 어려움을 겪고 있기 때문에 이분들을 지원하는 것과 동시에 또 비슷한 위기가 저에게 닥쳤을 때 어떻게 좀 더 잘 대응할 수 있을까, 아까 말씀드렸던 그 리질리언스를 강화하는 부분이 굉장히 중요하다고 생각합니다. 그리고 마지막으로 오늘 그 파키스탄의 이머전시 리스폰스 캐시 프로그램에서 언급됐던 것처럼 그 디지털 기술의 활용이 앞으로 코로나와 같은 위기에 대응하는 데 굉장히 중요하고, 이 부분을 이제 우리 그 코이카와 한국 정부에서 계속해서 노력해서 지원할 부분이라는 것을 말씀을 드립니다. 파키스탄 케이스에서 본 것처럼 디지털화 그리고 또 자동화 이런 부분들은 결국 저희가 이런 코로나와 비슷한 위기에 대응하는 보다 빨리 그리고 또 보다 투명하게 대응하는 데 도움을 주고 있기 때문에 단순히 이런 긴급 대응에서뿐만이 아니라 교육이라던가 아니면은 그 의료, 뭐 산업 부분에서의 그 기술을 활용하는 부분들을 적극적으로 지원하려고 하고 있습니다. 그래서 네. 그래서 마지막으로 코로나가 보여준 것은 저희가 이런 그 위기가 단순히 한 국가에 국한된 것이 아니라 모든 국가를 넘나들고 있고 또 앞으로도 단순히 한 번 일어난 일이 아니라 계속해서 발생할 수 있다는 것을 보여주고 있습니다. 그래서 그런 것을 고려할 때 한 국가의 노력만으로 해결할 수 없는 이런 위기에 대응하기 위해서 개발 협력이 더욱더 필요하고 그리고 아까 말씀드렸던 그 resilience, 그 회복력을 강화하기 위해서 계속해서 서로 노력하는 것이 필요하다고 생각합니다. 그래서 그런 면에서 이런 사크와 같은 그 리저널 코오퍼레이션 메커니즘이 굉장히 중요하다고 생각하고 있으며 앞으로도 해서 계속해서 이렇게 함께 저희 파트너 국가들과 함께 노력해 나가도록 하겠습니다. 네, 감사합니다.
예, 감사합니다, 실장님. 저희들이 굉장히 많은 노력을 하고 있는 것 같습니다. 코비드에 대해서 중장기적인 지원 전략도 마련하고 특히 보건 분야의 취약계층을 위한 노력들 굉장히 중요한 노력이라고 저도 생각을 합니다. 그리고 앞으로 그 디지털에 대한 디지털화를 통한 그 협력 굉장히 중요하고 앞으로 그에 대해서 중장기적으로 노력을 해 나가야 될 것 같습니다. 예, 감사합니다. 예, 마지막으로 김미수 교수님께서 토론해 주시겠습니다. 이
네,
나머지 시간은 김미수 교수님이 잘 통제해 주실 것이라고 믿습니다.
네, 안녕하세요. 저는 한국외대 인도연구소 김미수라고 합니다. 이수철 교수님의 요청에 따라 저는 아주 짧게 간단하게 말씀을 드리도록 하겠습니다. 사실은 남아시아는 다른 나라들에 비해서 굉장히 빈곤율이 높은 상황입니다. 그러니까 사하라 아프리카 그러니까 섭사하란 아프리칸 국가들에 비해서 그 국가들이 가장 빈곤율이 높고, 그러니까 남아시아 국가들이 두 번째로 빈곤율이 굉장히 높기 때문에 사실은 남아시아에서 그 빈곤 퇴치는 굉장히 중요한 이슈입니다. 그런데 이제 최근에 아까 이제 발표자들께서도 이미 PPT에서 말씀하셨듯이 최근에 인도를 포함한 방글라데시 등의 국가에서 굉장히 높은 경제 성장률을 달성하면서 최근에 빈곤율이 굉장히 급격하게 낮아졌습니다. 그런데 문제는 이 코로나 바이러스 사태로 인해서 지금 다 설명하셨듯이 갑자기 그 마이그런트 워커들이나 아니면 인포멀 워커들이 갑자기 레이오프 되는 상황이 되면서 이 사람들의 그런 실업률이 높아지고 이 사람들이 결국은 잡을 찾지 못한 상황에서 다시 농촌 지역으로 돌아가는 상황이 되면서 결국은 전반적인 그런 인컴 레벨이 낮아지고 이분들이 결국은 다시 그 빈곤의 그런 어떤 사이클에 다시 빠지게 되는 그런 악순환에 빠지게 되었습니다. 저는 사실은 이 상황에서 한국 정부가 할 수 있는 거는 뭐 디지털이나 IT 부분에 대한 협력, 그리고 교육에 대한 협력, 보건 부분의 협력도 굉장히 중요하다고 생각을 하지만 굉장히 장기적인 관점에서는 저는 오히려 농촌 부분에 대한 남아시아 지역의 농업 부분에 대한 협력을 좀 한국이 강화했으면 좋겠다는 생각을 하고 있습니다. 사실은 이 부분에 대해서 제가 아까 임소연 실장님께도 말씀을 드렸고 한번 의견을 여쭤보기도 했는데요. 제 개인적으로는 사실은 그 농업 부분 협력에 관심이 많이 있어서 많이 자료를 찾아보았는데 한국이 굉장히 베트남이나 인도네시아나 이런 동남아시아 국가에서는 그 민간 협력을 차원에서 굉장히 적극적으로 농업 부분, 그 농촌 지역 부분에 대한 개발을 굉장히 적극적으로 하고 있고 실제로 굉장히 성공적인 사례가 많습니다. 한 예로 그 코이카와 CJ가 베트남에서 그 고추 농사 기술을 개선하는 작업을 그 프로젝트를 시행을 했는데요. 실제로 베트남에서 가장 못 사는 지역을 선택을 했고 그 지역의 전반적인 인컴 레벨도 많이 올라갔고 포버티도 거의 제가 찾은 자료에 따르면은 거의 반 이상이 그 빈곤율이 감소가 되었습니다. 그리고 그 단순히 농업 기술을 전달하는 것뿐만 아니라 그 지역의 전반적인 교육 수준이나 아니면은 그 농민들이 앞으로 뭔가 서스테이너블한 삶을 살 수 있도록 도와주는 프로그램을 진행을 했는데요. 아직 제가 알기로는 남아시아에서는 이런 적극적인 협력을 시행한 바가 없습니다. 저는 오히려 이런 부분을 조금 더 오히려 남아시아에서는 이런 조금 좀 더 실질적인 접근이 필요하지 않을까라는 생각을 좀 더 해봤습니다. 네, 제가 아무래도 시간을 너무 뺏으면 안 될 것 같아서요. 여기까지 하도록 하겠습니다.
감사합니다. 정확하게 6시 반까지 딱 맞춰주신 것 같습니다. 너무 감사드리겠습니다. 자, 사실은 저희들이 굉장히 농촌 부분에서의 협력 굉장히 중요한 것 같습니다. 저희들이 그 남아시아 지역에서 특히 농업이 차지하는 비중과 거기에 종사하시는 분들을 생각하시면 거기에 집중적으로 협력을 하고 거기로부터 빈곤을 구제하는 방법을 찾아보는 것도 괜찮은 것 같습니다. 오늘은 여기까지 전부 마치는 걸로 하고 지금까지 발표해 주신 분들 저희들이 굉장히 많은 양을 발표해 주셨고 그리고 이제 토론해 주신 분들께 감사드립니다. 그리고 여기 그 사크 관련해 주신 그 외교부하고 관련된 모든 국가들에게 감사드리겠습니다. 그리고 우리 그 인도연구소 한국에 대해 인도연구소 소장님 감사드리겠습니다. 예, 여러분 감사드리겠습니다.
Now, this is the end of the session 3. I hope this session was very meaningful to you. Thank you, Chair, panelists, and the participants. Distinguished guests, ladies and gentlemen, this concludes all the sessions of 2020, the 11th Republic of Korea-SAARC Partnership Seminar. This seminar will be the great step to learn RK-SAARC cooperation on public health and poverty alleviation in the time of COVID-19. I hope all the attendants enjoyed this seminar. Now, we will have a dinner at our room, 6th floor across of this meeting room in this hotel. Please enjoy the dinner. Once again, thank you so much for your attention. Please make sure to bring all your belongings with you. Thank you.